Two uniformed military police officers seized the young nurse by both arms and hauled her through the lobby while every patient in the waiting room stopped breathing. Her badge clattered against the tile floor. No one picked it up. 30 seconds later, the deafening roar of incoming Black Hawk helicopters rattled every window in Elkhorn Valley Medical Center, and the color drained from every face in the building, including the arrogant surgeon who had just ordered her removed. He had called her disposable. He had no idea what he'd just thrown away. If you want to follow this story all the way to the end, hit that like button and drop a comment telling me which city you're watching from so I can see just how far this story has traveled. The morning shift at Elkhorn Valley Medical Center started the way most Monday mornings did in Briarfield, Montana. Understaffed, overcaffeinated, and 15 minutes behind before the first patient even checked in. Fluorescent lights buzzed in the second-floor hallway, where a line of gurneys sat parked against the wall like abandoned shopping carts. And somewhere near the stairwell, a janitor's mop bucket had tipped over, leaving a thin river of gray water creeping toward the elevator bank that nobody had bothered to clean up. Marin Calloway noticed it because she noticed everything. She grabbed a handful of paper towels from the nearest dispenser, dropped them across the spill, and kept walking without breaking stride. She was 23 years old, 5'6", with dark blonde hair pulled into a ponytail so tight it gave her a faint headache by noon every single day. Her scrubs were a size too large because the hospital had run out of smalls 3 weeks ago, and nobody in supply had gotten around to reordering. She looked, by every visible measure, like exactly what people assumed she was. A junior nurse barely old enough to rent a car, occupying a bottom-rung position at a mid-tier regional hospital in a town most Americans couldn't find on a map. That assumption had kept her alive for 2 years. She intended to keep it that way. The emergency department at Elkhorn Valley was a 40-bed unit that regularly held 55 patients on a bad day and 60 on a catastrophic one. Today was shaping up to be catastrophic. A charter bus had skidded off the interstate 20 miles east around 4 in the morning, and the first wave of trauma cases had already filled the department before sunrise. By the time Marin clocked in at 6:45, every bay was occupied. The triage line stretched past the ambulance entrance, and the charge nurse, a heavy-set woman named Donna Pelfrey, who had been doing this job for 19 years, looked like she wanted to sit down on the floor and never stand up again. "Calloway, thank the Lord," Donna said when she saw her. "Bay 12, multi-system trauma, intubated in the field. Ortho's been paged, but nobody's showed up yet. I need you in there 5 minutes ago." Already heading. "And Bay 14's got a post-surgical bleeder who's been calling for someone every 3 minutes. His IV pump's alarming, and I don't have a single body to send." "I'll take both." Donna stared at her for half a second, the way she sometimes did when Marin said things that didn't match her age or her title. Then she nodded and turned back to the ringing phone. Marin moved through the department with the kind of efficiency that came from a place she never talked about. She checked the intubated patient in Bay 12 first, a man in his 50s with a shattered pelvis, 2 broken ribs, and a tension pneumothorax that the paramedics had decompressed in the field with a needle. The chest tube was draining properly. His oxygen saturation was holding. She adjusted the ventilator settings by 2 points, rechecked the drainage output, documented everything in under 4 minutes, then crossed the hall to Bay 14 where a 71-year-old man named Gerald was pressing his call button with the desperate rhythm of someone tapping out Morse code. "Nobody comes," Gerald said the moment she walked in. "I've been bleeding through this dressing for 20 minutes and nobody comes. I'm here now." She pulled on gloves and peeled back the surgical dressing over his abdomen. The bleeding was superficial, a small vessel near the incision site that hadn't been cauterized properly during his gallbladder removal the day before. It needed pressure, not panic. She applied a fresh hemostatic pad, secured it with tape, and silenced the IV pump alarm, which had been triggered by a kinked line, not an actual malfunction. "Is it bad?" Gerald asked. "It's manageable. The bleeding's from a tiny surface vessel. I'm going to have the surgical resident come take a look, but you're not in danger." The other nurses didn't even check. Marin didn't respond to that. She adjusted his pillows, refilled his water cup, and made a note in the chart to flag the resident. It wasn't her place to comment on what other nurses did or didn't do, and she had learned a long time ago that defending herself by criticizing others was a game that only produced losers. She was halfway back to Bay 12 when the overhead paging system crackled. "Dr. Rennick to emergency, Dr. Rennick to emergency, stat." The name made her stomach tighten by exactly 1 degree. Dr. Theodore Rennick was Elkhorn Valley's chief of surgery, a tall, silver-haired man in his late 50s who had been running the surgical department for 11 years with the unshakable confidence of someone who had never once been told he was wrong. He was board-certified, fellowship-trained, and ludicrously credentialed. He was also, in Marin's carefully contained opinion, one of the most dangerous physicians she had ever worked with, because he confused authority with competence and treated disagreement as insubordination. She had watched him dress down residents in front of patients. She had seen him override nursing assessments without reading them. And 3 months ago, she had witnessed him make a medication dosing error during a code blue that she had quietly corrected before anyone noticed, because the alternative, letting a patient die to prove a point, was not something she was capable of doing, no matter how much easier it would have made her life afterward. Rennick never knew she'd fixed it. Nobody did. That was the point. Today, however, the emergency department was already a pressure cooker, and Rennick arrived looking like a man who had been woken up from a nap he felt entitled to. He came through the ambulance bay doors with his white coat half-buttoned and his reading glasses still perched on top of his head, flanked by 2 surgical residents who trailed him like anxious ducklings. "What's the situation?" he barked at Donna. "Bus accident. Multiple traumas. We're at capacity plus 15, and I've got 2 critical cases that need surgical consult, Bay 12 and Bay 19. Who's been managing 12? Calloway." Rennick's expression shifted. It was subtle, a slight narrowing of the eyes, a micro-adjustment of the jaw. But Marin caught it from across the hall because she had spent years reading faces under conditions far worse than a crowded emergency room. He didn't like her. She knew that. He didn't like any nurse who moved with confidence, because confidence in a subordinate felt like a threat to a man whose entire identity was built on hierarchy. "Get her out of my bay," he said, loud enough for 3 other nurses to hear. "I don't need a first year holding my patient's hand." "She's not first year," Donna said carefully. "She's been here 2 years, and she's one of our strongest." "I didn't ask for her resume. I asked for her to move." Marin was already stepping back from Bay 12 when Rennick entered. She handed him the chart without being asked. He didn't take it. He looked at the ventilator readings, looked at the chest tube output, and then looked at Marin with the particular kind of contempt that some men reserve for women who do things correctly without being supervised. "Who adjusted the vent settings?" "I did. His tidal volumes were running high for his body weight and his plateau pressures." "Did I ask you to adjust my ventilator?" "He wasn't your patient when I made the adjustment. He was an unassigned trauma admit, and his respiratory parameters needed—" "What you needed," Rennick said, cutting her off with the practiced ease of a man who had been interrupting people for decades, "was to wait for a physician order. You're a nurse. You assist. You don't make independent clinical decisions on intubated patients. Are we clear?" The 2 residents behind him exchanged a glance, but said nothing. Donna, standing near the doorway, looked like she was biting through the inside of her cheek. Marin felt something old and familiar move through her chest. Not anger exactly, something colder, something trained. The reflex to respond with precision under hostile pressure. The instinct to neutralize a threat by delivering facts so cleanly that the aggressor had no room to maneuver. She had used that instinct in places where the consequences of hesitation were measured in body counts, not performance reviews. But she wasn't in those places anymore. She was in a hospital in Montana, and she was a nurse. And the hierarchy said he was right even when he was wrong. "Understood, Dr. Rennick." He stared at her for another 2 seconds, waiting for something. Defiance, maybe, or an apology he could reject. When he got neither, he turned back to the patient and began issuing orders to his residents without acknowledging that every single intervention Marin had performed was textbook correct. She left the bay and went back to work. The next 3 hours were a blur of controlled chaos. More bus accident patients arrived. 2 cardiac cases came in through the walk-in entrance. A child with a broken arm screamed for 45 minutes straight while waiting for pediatric ortho. Marin moved between patients the way she always did. Methodical, calm, invisible. She started IVs, administered medications, repositioned patients, updated charts, and managed 3 simultaneous crises without once raising her voice or asking for help she didn't need. At 10:15, the thing she had been afraid of since the moment Rennick walked in finally happened. Bay 19 held a 44-year-old woman named Sandra Oakes, who had been brought in from the bus accident with internal abdominal injuries. She had been stable on arrival, but her blood pressure had been slowly declining over the past 2 hours, a trajectory that Marin had flagged in the chart, verbally reported to the charge nurse, and twice attempted to bring to the attention of the surgical team. Both times, Rennick's residents had told her the surgeon would get to it when he was ready. At 10:15, Sandra's blood pressure dropped from 92 systolic to 68 in under 3 minutes. Marin was at her bedside in seconds. She checked the patient's abdomen, rigid, distended, markedly worse than the last assessment, classic presentation of an expanding intra-abdominal hemorrhage. Sandra needed surgery immediately, not in 20 minutes, not after Rennick finished whatever he was doing in Bay 12. Now. Marin hit the code button. The alarm brought the rapid response team, 2 residents, and Rennick himself, who arrived looking annoyed rather than concerned, which told Marin everything she needed to know about how seriously he had taken her earlier reports. "What's happening?" Rennick demanded. "Sandra Oaks, Bay 19, systolic dropped to 68. Abdomen is rigid and distended. She's hemorrhaging internally and she needs an emergent X-lap." Rennick glanced at the monitor. Then he looked at Sandra, who was barely conscious, her skin the color of wet cement. Then he looked at the chart, and Marin saw the exact moment he realized he should have listened 2 hours ago. But Theodore Rennick was not a man who acknowledged mistakes. He was a man who reassigned them. "Why wasn't I notified about the pressure trend?" he said, turning toward the residents. "I documented it at 0840 and again at 0912, Marin said. Her voice was steady. "Both entries are in the chart. I also verbally reported to your team twice. I'm asking my residents, not you." The senior resident, a young man named Dr. Holt, who looked like he hadn't slept in 30 hours, swallowed hard. "She did report it, Dr. Rennick. I told her we'd get to it after—" "Get the OR ready," Rennick snapped, suddenly all motion. "Type and cross for 4 units. Move." They moved Sandra to the operating room in under 8 minutes, which was fast, but not fast enough to undo the 2 hours of inaction that had preceded it. Marin helped prep the patient, set up the transfusion, and stayed until the surgical team took over. She didn't know yet whether Sandra Oaks would survive. She did know that if the woman died, it would be because a warning had been ignored, not because it hadn't been given. She also knew, with the cold certainty of someone who understood institutional power, exactly what was about to happen next. It happened at 11:40. Marin was restocking a supply cart near the nursing station when Rennick appeared in the hallway with the hospital's chief administrative officer, a thin, gray-suited man named Boyd Worthen, and 2 members of hospital security. Donna Pelfrey stood 10 feet behind them, her face white, her hands balled into fists at her sides. "Calloway," Rennick said. His voice carried the hallway. 3 nurses at the station stopped typing. A patient in a wheelchair turned to look. "Step away from the cart." She stepped away. "It's come to my attention," Rennick continued, speaking with the performative gravity of a man delivering a verdict he had already written, "that you made unauthorized changes to ventilator settings on an intubated patient this morning without a physician order. You also failed to properly escalate a deteriorating patient in Bay 19, resulting in a delayed surgical intervention that may have compromised patient outcomes." The hallway went completely still. Marin felt something fracture inside her chest. Not her composure, but something deeper. The belief, maybe, that doing the right thing would eventually matter. That competence would be its own protection. That she could exist quietly in this world without being punished for it. "Dr. Rennick," she said, "the ventilator adjustment was within nursing scope for the clinical situation, and I escalated Sandra Oaks twice, both verbally and in writing. The chart documents what you entered," Rennick said. "It doesn't document what actually happened. And right now, what I'm telling administration is that a junior nurse made independent decisions above her level and a patient suffered for it." Marin looked at Boyd Worthen. The administrator wouldn't meet her eyes. She looked at Donna. The charge nurse's jaw was trembling, but she said nothing, and Marin didn't blame her because Donna had 3 kids and a mortgage, and Rennick had the power to make anyone's life miserable. "You're being placed on immediate administrative leave pending investigation," Worthen said, reading from what appeared to be a prepared statement. "Please surrender your badge and any hospital-issued equipment." "You're firing me." "We're suspending you." "You're firing me in front of patients," Marin said quietly, and something in her tone made one of the security guards shift his weight uncomfortably. "This is a personnel action, not a termination," Worthen recited. "Then why are there security guards?" Nobody answered. Marin unclipped her badge. She looked at it for a moment. The small laminated rectangle with her photo, her name, her title. Registered nurse. 2 words that she had earned in a life after the one nobody knew about. 2 words that meant she had chosen to heal instead of... She set the badge on the supply cart. "I'll need you to exit through the main lobby," one of the security guards said. He was young, maybe 25, and he looked like he hated every second of what he'd been told to do. "I know where the door is." They walked her down the hall, past the nursing station where her co-workers stared. Past Bay 14 where Gerald, the post-surgical patient, craned his neck to watch. Past the waiting room where a dozen people sat in uncomfortable chairs under a muted television, witnessing a woman being escorted out of a hospital like a criminal while wearing scrubs stained with the blood of patients she had saved that morning. Rennick watched from the hallway. He didn't follow. He didn't need to. The performance was complete. Marin pushed through the main lobby doors into the late morning sun. The air outside was cool and dry, the way Montana air always was in early fall, and the parking lot stretched out in front of her like a gray ocean with nothing on the other side. Her car was parked in the back row, a 12-year-old Subaru with a cracked windshield and a bumper sticker she'd been meaning to peel off for 6 months. She had $43 in her checking account. Her rent was due in 9 days. She had no family in the state, no safety net, and no plan for what came next, because she had spent the last 2 years building a life that was small enough to be safe and quiet enough to be invisible. And now that life had been taken from her by a man who couldn't admit he'd almost killed a patient. She was halfway across the parking lot when the sound hit. It came from the east, a deep rhythmic thudding that vibrated in her sternum before her ears fully registered it. Rotors, multiple aircraft, heavy lift. She stopped walking and turned toward the horizon, and what she saw made her stand completely still. 3 Black Hawk helicopters in tactical formation, descending fast toward the hospital's rear parking area. Behind them, visible on the 2-lane road leading to Elkhorn Valley's main entrance, a convoy of olive-drab military vehicles, 2 armored Humvees and a communications truck with antenna arrays bristling from its roof. Marin's pulse did something it hadn't done in 2 years. It didn't accelerate. It dropped. A controlled deceleration, 4 beats per minute slower, the way her body had been trained to respond when the operational environment shifted from routine to critical. Her breathing slowed to match. Her peripheral vision widened. Her hands, hanging at her sides, went perfectly still. She knew what this was. She just didn't know why it was here. Inside the hospital, the reaction was immediate and chaotic. The helicopter noise alone was enough to send patients into panic. The windows on the east side of the building rattled hard enough to shake loose a ceiling tile in the radiology hallway, and the vibrations triggered 2 separate fall risk alarms on the 3rd floor. Nurses ran to windows. Security guards reached for radios. Donna Pelfrey picked up the emergency line and called the front desk, asking if anyone had been notified about a military exercise, and the answer was no. Nobody had been notified about anything. Boyd Worthen, still standing in the hallway where he'd just suspended Marin, pulled out his phone and called the hospital director, a woman named Joan Kemper, who was in a budget meeting across town. He got her voicemail. He called again. Voicemail again. Rennick, who had been walking back toward the OR, stopped at the nearest window and watched the helicopters land. His expression was the kind of controlled blankness that came from a man who did not like events he could not manage. The front entrance doors opened 3 minutes later. 6 soldiers entered the lobby in full tactical gear. They weren't National Guard. They weren't reservists on a community outreach visit. They were active-duty special operations, the kind of soldiers whose unit patches most civilians wouldn't recognize and whose bearing communicated a single, unmistakable message. We are not here for a social call. The lead soldier, a sergeant first class with a jaw like a shovel blade, approached the front desk with the terrifyingly polite efficiency of someone trained to secure buildings. "Ma'am, I need you to direct me to your hospital administrator. Colonel Pearson will be entering the facility in approximately 90 seconds, and he'll require access to your executive offices." The receptionist, a woman named Linda, who had worked the front desk for 12 years and had never seen anything more dramatic than a code pink drill, stared at him with her mouth slightly open. I Who? Colonel Nathan Pearson, United States Army Special Operations Command. He's here on official business, and he'll explain everything when he arrives. In the meantime, I need to ask you to keep all exits clear and all personnel in their current locations. Linda picked up the phone and called Boyd Worthen. Worthen arrived in the lobby 45 seconds later, flanked by two confused security guards and wearing the expression of a man who had just been informed that the building he was standing in might not actually be his building anymore. I'm Boyd Worthen, Chief Administrative Officer. What exactly is going on? Sir, Colonel Pearson will brief you directly. He'll be inside in just a moment. Brief me on what? We haven't received any notification from... The front doors opened again. Colonel Nathan Pearson walked in like a man entering a room he'd already mapped in his head. He was in his late 40s, lean, weathered, with the kind of face that had been shaped by sun and sand and decisions that most people would never have to make. He wore a dress uniform with a command insignia that Worthen didn't recognize, but that one of the security guards, a former Army corporal, immediately did. The guard straightened up without thinking about it. Behind Pearson walked two officers carrying file cases and a military police captain with a sidearm on her hip. Pearson scanned the lobby. His eyes moved across the reception desk, the waiting room, the hallway leading to the emergency department. They moved across Worthen and the security guards and the cluster of nurses who had gathered near the corridor entrance, drawn by the noise and the uniforms and the unmistakable electricity of something unprecedented. Then his eyes stopped. Through the glass entrance doors visible in the parking lot, Marin Calloway was still standing where she had frozen, halfway between the building and her car, her oversized scrubs catching the mountain wind, her face turned toward the convoy with an expression that no one in the hospital had ever seen her wear before. Pearson looked at her for a long time. Then he turned to the sergeant first class. Bring her inside. Two soldiers walked out through the front doors, crossed the parking lot with measured strides, and reached Marin in under 30 seconds. They didn't grab her. They didn't speak with urgency or aggression. The sergeant simply stopped 3 feet in front of her and said, in a voice low enough that only she could hear, "Ma'am, Colonel Pearson is requesting your presence inside the facility." Marin didn't move for a full 5 seconds. "Tell him I'm not active anymore," she said. "He's aware, ma'am. He's requesting, not ordering." She looked past the sergeant toward the hospital entrance, where a dozen faces were pressed against the lobby glass, watching this exchange with the frozen intensity of people who had absolutely no framework for understanding what they were seeing. She could see Donna's face among them. She could see two of the residents. She could see the security guard who had walked her out 15 minutes ago. "All right," she said. She walked back toward the building. The soldiers flanked her, not escorting, not restraining, but walking beside her with the instinctive formation awareness of people who had trained alongside someone they respected. Their body language wasn't custodial. It was protective. The lobby doors opened. Marin stepped inside. The air conditioning hit her face and she could smell that particular hospital smell, industrial cleaner and recycled air and something faintly metallic that she'd never been able to identify. And for a moment she was back in a different facility entirely, a forward surgical unit in a place she would never name, where the smell was worse and the lights were dimmer and the patients weren't accident victims, but soldiers who had been torn apart by things designed to tear people apart. She pushed the memory down. She was here. She was now. Colonel Pearson stood in the center of the lobby. He had not moved since the soldiers left. When Marin walked through the doors, something shifted in his face, a fracture in the military control, brief and unmistakable. His jaw tightened. His eyes changed. Not quite emotion, not quite memory, but something in between that only someone who had shared a specific kind of experience would recognize. He stepped forward. And then Colonel Nathan Pearson, commanding officer of one of the most elite special operations units in the United States military, removed his beret, held it against his chest, and saluted a 23-year-old nurse in blood-stained oversized scrubs standing in the middle of a civilian hospital lobby. "Ma'am," he said, "we've finally found you." The lobby went absolutely silent. Worthen's mouth opened, but nothing came out. Donna Pelfrey's hand went to her face. At the far end of the hallway, just visible through the corridor entrance, Dr. Theodore Rennick stood frozen beside the nursing station. He had come to see what the commotion was about. He had expected a military exercise, maybe a dignitary visit, something he could insert himself into and leverage later in a departmental email. What he had not expected, what his entire framework of understanding was not equipped to process, was the sight of a full-bird colonel saluting the nurse he had just thrown out of his building. Myron stood there. She did not salute back because she was not in uniform, and she was not, by any definition she had chosen for herself, a soldier anymore. But her posture changed, a straightening of the spine that was involuntary, muscle memory from a version of herself she had spent 2 years trying to bury. "Colonel," she said, "you shouldn't have come. That wasn't your call to make." Pearson lowered his hand. "And frankly, ma'am, disappearing from the grid after what you did made it considerably harder than it needed to be." That was the point. He almost smiled. Almost. "We need to talk, somewhere private." Worthen stepped forward, his administrative reflexes finally catching up with his confusion. "Colonel, I need to understand what's happening. This is a civilian medical facility, and you've just—" "Mr. Worthen." Pearson turned toward him with the quiet authority of someone who didn't need to raise his voice to fill a room. "I'm fully aware of where I am. I'm also aware of what you just did." He glanced toward the security guards, then back to Worthen. "We'll get to that." The words landed like a dropped scalpel, clean, precise, and impossible to ignore. Pearson turned back to Marin. "Is there a conference room?" Worthen, operating on autopilot, directed them to the administrative wing. As they moved down the hallway, Pearson, Marin, 2 officers, and the MP captain. Every staff member they passed stopped what they were doing. Some stared. Some stepped aside. One young nurse pressed herself flat against the wall, as if a presidential motorcade were passing through. Marin walked with her eyes forward, her expression unreadable, her hands loose at her sides. She looked exactly like what she had always looked like to everyone in this building, a quiet, competent, unremarkable young nurse who happened to be very good at her job. But she was walking differently now. The people who noticed it couldn't have explained how or why. Her stride hadn't changed length. Her speed hadn't increased. Something about her center of gravity had shifted, something in the set of her shoulders, as if a weight she had been carrying, or pretending to carry, had been redistributed. Donna Pelfrey noticed. She watched from the nursing station with tears she didn't understand running down her face. Dr. Rennick noticed too. He watched from the corridor entrance, and for the first time in 11 years at Elkhorn Valley Medical Center, Theodore Rennick felt something he hadn't felt since his 3rd year of residency, when an attending had caught him lying about a lab result. He felt afraid. The conference room door closed behind them, and the hallway hummed with whispered speculation that would not stop for the rest of the day, and would not come close to the truth. Behind that door, Colonel Pearson set a black military briefcase on the table, unlocked it with a biometric clasp, and removed a sealed envelope stamped with classification markings that Marin recognized instantly. "You know what these are," he said. "I told your people I didn't want them. You told my people a lot of things. You told them you were done. You told them you wanted to be left alone. You told them to lose your file." He paused. "The problem, ma'am, is that some things can't be unfiled, and some debts don't expire because the person who's owed decides they don't want to collect." Marin looked at the envelope but didn't touch it. Her fingers rested on the edge of the conference table, and Pearson noticed that her hands were absolutely steady. The same hands that had been absolutely steady 4 years ago in a forward operating base when everything around them had been fire and noise, and the particular chaos that only exists when an operation goes catastrophically wrong. 4 years ago, Pearson said quietly, an IED detonated during a high-value extraction in a location I'm still not authorized to name in a civilian setting. The blast killed 2 members of my team instantly and left me clinically dead for 3 minutes and 41 seconds. He stopped. His voice didn't waver, but the effort of keeping it level was visible in the cords of his neck. "The combat medic attached to our unit, a 20-year-old specialist with no surgical authority and no backup, performed a field thoracotomy, restored cardiac function, controlled hemorrhaging from 4 separate wound sites, and kept me alive for 97 minutes until extraction arrived." He looked at her. "That medic was you." The room was silent. "You saved 6 other soldiers that night. You treated 11 casualties total with supplies meant for 4. And when the medevac finally landed, the flight surgeon said he had never seen field medicine performed at that level by anyone, enlisted, commissioned, or civilian. Marin said nothing. After the mission, you were recommended for the highest valor commendation available to non-commissioned personnel. You refused it. You refused the ceremony. You refused the promotion. And then you filed separation papers and vanished from the system so completely that it took us 2 years to locate you. He tapped the envelope. In a hospital in Montana, working as a floor nurse. I'm an emergency department nurse, Marin said, and the correction was so small and so stubborn that Pearson actually did smile this time. Briefly, barely, the way a man smiles when he recognizes something familiar in someone he respects. You were also, he said, discharged with a service record that 3 separate commands tried to classify because they didn't want anyone asking how a specialist that young had been placed in that operational role in the first place. Kishatas. His expression hardened. There are people at the Pentagon who still don't know the full story of what happened that night. But I was there. I died there, and you brought me back. And I did not spend 2 years looking for you so that I could watch you get walked out of a building by security guards while a surgeon who isn't fit to hold your gauze takes credit for your work. Marin's jaw tightened. 1 degree. Then it released. What do you want, Colonel? Right now, I want to have a conversation with your hospital's leadership about what happened this morning. I have an investigative team that's been compiling information on this facility for unrelated reasons, and what they've found intersects with what I just watched happen to you in ways that concern me. He paused. After that, I want to offer you something, but the offer can wait. And if I say no to all of it, then you say no. You're a civilian. I can't order you to do anything. He held her gaze. But I'm asking you not to walk away. Not yet. Not before you see what's behind that door. Marin looked at the sealed envelope on the table. She looked at the briefcase with its biometric lock. She looked at the door of the conference room, beyond which she could hear the muffled sounds of a hospital that was still running, monitors beeping, phones ringing, the distant wail of a patient in pain. Her hospital. Her patients. The place she had chosen because it was ordinary. Because nobody asked questions. Because nobody looked at a 23-year-old nurse in oversized scrubs and saw anything worth investigating. 1 conversation, she said. That's all I'm agreeing to. Pearson nodded. He reached for his phone and made a call that lasted 9 seconds. Send them in, he said. And somewhere in the hospital corridor, the sound of footsteps multiplied, heavy, deliberate, and heading straight for the administrative wing, carrying with them the weight of files and evidence and a truth that Dr. Theodore Rennick had built his entire career trying to make sure nobody ever found. The conference room door opened and 3 people entered in quick succession. 2 men in civilian suits carrying hard-shell document cases and a woman in a Navy JAG uniform whose expression suggested she had not smiled since approximately 2019. They moved with the coordinated efficiency of people who had done this exact thing in dozens of facilities across the country, and when they set their cases on the table and opened them, the volume of paperwork inside made Marin's stomach drop, because she recognized the format. She had seen investigation files before. These were thick enough to end careers. Colonel Pearson stood and made no introductions. He simply looked at the JAG officer and said, "Brief her." The woman, Commander Reyes, according to the nameplate on her uniform, turned to Marin with the particular directness of a military lawyer who understood that civilians found her profession terrifying and did not especially care. Ms. Calloway, I'm going to tell you what we know, and then I'm going to ask you some questions. You're not under investigation. You're not a suspect in anything. You are, however, a material witness to events that have triggered a federal inquiry, and your cooperation, while voluntary, would be extremely helpful. She paused. Do you understand? I understand the words, Marin said. I don't understand why a Navy JAG commander is sitting in a hospital conference room in Montana. Joint investigation. Army CID initiated. JAG oversight. The specifics of why it's joint are classified, but the short version is that Dr. Theodore Rennick came to the attention of federal investigators 8 months ago through channels unrelated to you. Marin's expression didn't change, but something behind her eyes shifted, a recalculation. She had assumed this was about her, about the morning, about the humiliation in the hallway and the suspension that was still technically in effect. But 8 months was a long time. 8 months meant this was bigger than one bad day. "What channels?" she asked. Reyes opened the first document case and removed a manila folder. "Are you familiar with the Department of Defense Medical Oversight Program?" "Vaguely. It monitors military-affiliated hospitals and any civilian facility that receives DoD contract funding for veteran care. Elkhorn Valley Medical Center receives approximately $4.2 million annually in DoD contracts to provide post-deployment medical services to veterans in the Briarfield corridor. That funding comes with federal compliance requirements, staffing ratios, documentation standards, outcome reporting. 8 months ago, a routine audit flagged statistical anomalies in Elkhorn Valley's surgical complication rates." "What kind of anomalies?" "The kind where the numbers look too clean." Reyes laid 3 pages of spreadsheets on the table. "Surgical complication rates here have been reported at roughly half the national average for facilities of this size. Postoperative infection rates are listed at nearly 0 for the past 2 years. Patient outcome scores are consistently in the 98th percentile." She looked up. "Those numbers are not possible for a 40-bed regional emergency department handling the case volume this facility handles. They're not possible for any facility. They are, however, exactly the kind of numbers you'd produce if someone were systematically altering medical records after the fact." The room went quiet. Marin felt the hair on her forearms rise, not from fear, but from recognition. She had spent 2 years watching things at Elkhorn Valley that didn't add up. Charts that changed overnight, complication codes that vanished between shifts, post-surgical notes that appeared in the system hours after procedures ended, written in language that didn't match what had actually happened in the operating room. She had noticed. She had always noticed. She had told herself it wasn't her problem because she was trying to stay invisible, and invisible people don't report systemic fraud to federal agencies. That calculation felt different now, sitting across from a JAG commander with a table full of evidence. "You're saying Rennick has been falsifying records," Marin said. It wasn't a question. "We're saying that someone at this facility has been systematically altering surgical documentation to inflate outcome metrics, and those altered metrics have been used to maintain federal funding eligibility and to support Dr. Rennick's applications for 2 National Surgical Excellence Awards he received in the past 3 years. Reyes paused. "We're also saying that the pattern of alterations correlates precisely with procedures performed under Dr. Rennick's supervision, and that multiple former employees have provided statements indicating a culture of intimidation that discouraged internal reporting." But former employees, Marin repeated. "How many?" 7. All nurses or support staff, all separated from the hospital within 6 months of raising concerns about documentation practices. 4 of them were terminated for cause, using disciplinary language that is remarkably similar across all 4 cases. Marin said nothing for several seconds. She was doing math in her head, not numbers but timelines. 7 people. All gone. All silenced by a system that treated the person reporting the problem as the problem itself. And now she was number 8, walked out the door in front of patients because she had documented a warning that proved a surgeon had been negligent. "This morning," she said slowly, "Sandra Oaks. He delayed her surgery because he didn't listen to my escalation, and then he blamed me for the delay. That wasn't just ego. He was covering a complication that would have shown up in the outcome data." Reyes looked at Pearson. Pearson looked at Marin. The silence confirmed what she'd just said more loudly than any words could have. "Ms. Calloway," Reyes said, "I need to ask you directly. During your employment here, did you ever witness Dr. Rennick or anyone acting on his behalf alter, amend, or delete medical documentation after a procedure?" Marin's hands were on the table. They were still steady. They had been steady when she'd cracked a man's chest open in the dark, with a headlamp and a scalpel that wasn't designed for the procedure she was performing. They were steady now. "Yes," she said. 3 times that I can confirm. Probably more that I suspected but couldn't verify because the original records were overwritten before I could compare them. Reyes pulled out a second folder. "Can you walk me through each incident?" And Marin did. She sat in that conference room for 47 minutes and described, in clinical detail, 3 separate occasions when she had observed discrepancies between what happened during a surgical procedure and what appeared in the electronic medical record afterward. She gave dates, patient identifiers, the specific fields that had been changed, and the names of the staff members who had been present. Her recall was exact. Her language was precise. She did not editorialize or speculate. She reported the way she had been trained to report: facts, sequence, evidence, gaps. When she finished, Reyes closed her folder and looked at Pearson with an expression that said, very clearly, "This is the witness we needed." Pearson had been standing by the window for most of Marin's account, looking out at the parking lot where his vehicles were still parked and his soldiers were still posted. He turned back now and addressed Marin directly. "There's something else you need to know. Sandra Oaks, the patient from this morning. She's out of surgery. She's alive. But the operative report that was filed 20 minutes ago lists the cause of the delayed intervention as," he glanced at Reyes, "nursing failure to escalate," Reyes read from her phone. Specifically, the report states that the bedside nurse failed to adequately communicate the patient's deteriorating condition to the surgical team, resulting in a critical delay. Marin's jaw tightened. Not 1 degree this time. 3. "He filed that while I was sitting in this room." "He filed that while you were sitting in this room," Pearson confirmed. "Which means he's not just covering past incidents anymore. He's actively fabricating records in real time to shift blame onto a nurse he already suspended. And he's doing it in a facility that receives federal funding, which makes it a federal offense." The weight of that sentence settled over the room like concrete. "I want to talk to him," Marin said. "That's not advisable." "I didn't say it was advisable. I said I want to talk to him." Pearson studied her. He had seen that look before, 4 years ago, in a place where the air tasted like copper and diesel, when a 20-year-old medic had told a Special Forces captain twice her age to shut up and hold still while she cut into his chest. It wasn't anger. It wasn't bravado. It was the look of someone who had made a decision and wasn't interested in discussing alternatives. "Not yet," he said. "Let us do this the right way. Your way takes months. I've watched 7 people get pushed out of this building and nothing happened. Nothing ever happens the right way when the person doing the wrong thing has a title and a corner office. This time is different." "How?" Pearson reached into the briefcase and removed a single sheet of paper. He placed it on the table in front of her. It was a memorandum from the Office of the Inspector General, Department of Defense, authorizing an immediate on-site investigation of Elkhorn Valley Medical Center and granting the investigative team authority to compel testimony, seize records, and suspend federal funding pending review. "It's different," Pearson said, "because this time, someone with authority gives a damn." Marin read the memorandum twice. She set it down without comment. But her hands, for the first time since she'd walked back into the building, trembled, just slightly, just once, before going still again. Outside the conference room, the hospital was unraveling in slow motion. The presence of military vehicles and uniformed soldiers had created a gravitational distortion in the normal rhythm of the facility, pulling every conversation, every glance, every whispered phone call toward a single question. What is happening? Donna Pelfrey knew more than anyone, which meant she knew almost nothing. She had watched Marin get escorted out. She had watched Marin get brought back. She had seen a colonel salute her. And she had spent the past hour trying to hold the emergency department together while her best nurse sat in a conference room with people who carried briefcases with biometric locks. She was checking vitals on a cardiac patient in Bay 6 when Dr. Holt, Rennick's senior resident, appeared beside her with the expression of a man standing on a ledge. "Donna, I need to talk to you. I'm with a patient." "It can't wait." His voice cracked on the last word, and Donna looked up from the blood pressure cuff because in 19 years of nursing, she had learned to hear the difference between urgency and fear, and what she heard in Holt's voice was fear. She finished the vitals check, documented them, and stepped into the hallway. "What is it?" Holt's eyes were red, not from crying, from the particular strain of a person who was trying very hard not to. "Rennick told me to amend my notes on Sandra Oaks." Donna went very still. "He said the record needed to reflect that Calloway's escalation was insufficient, and that the nursing communication was the primary factor in the delayed intervention. He told me to backdate the amendment to 0930. And did you?" Holt's silence was answer enough. "David, I already did it." His voice was barely audible. "He told me 15 minutes ago, and I already entered the amendment. I wasn't thinking. When he tells you to do something, you don't..." He stopped. His hands were shaking visibly. "Donna, Calloway reported that patient twice. I heard her. I'm the one who told her we'd get to it. The delay wasn't her fault, it was mine. And now there's a federal investigation team in the building, and I just falsified a medical record because my attending told me to." Donna Pelfrey had been a nurse for 19 years. She had seen codes go wrong, patients die, equipment fail, and colleagues break. She had never, in all that time, felt the specific kind of fury that rose in her chest at this moment. A fury directed not at the trembling young resident in front of her, but at the system that had trained him to obey without thinking and the man who had weaponized that obedience. "You're going to fix this," she said. "How? The amendment is time-stamped. If I change it now, it'll show 2 modifications and—" "David, stop." She put her hand on his arm. "Listen to me. There are federal investigators in this building right now. Whatever you're afraid Rennick will do to you is nothing compared to what happens if they find a falsified record with your name on it and you didn't come forward. You need to go to that conference room and tell them what happened, right now, before this gets worse. He'll destroy my career. He's already destroyed his own. He just doesn't know it yet." Holt stood in the hallway for a long moment, his face cycling through expressions that told the entire story of a young physician who had entered medicine to help people and had somehow ended up standing in a corridor trying to decide between his conscience and his career. "Where's the conference room?" he asked. Donna told him. He walked away on unsteady legs, and Donna watched him go with the painful awareness that what she had just done, pushing a frightened resident toward the truth, was the same thing she should have done months ago when she first noticed the pattern of altered records. She hadn't. She had looked away, the same way everyone at Elkhorn Valley looked away, because Rennick controlled the operating rooms and the schedules and the recommendation letters and the quiet machinery of professional advancement that determined whether your career went up or went sideways. She went back to her patients because the emergency department didn't stop for institutional crises, and she spent the next hour working with a knot in her stomach that wouldn't loosen. In the conference room, the door opened and Dr. Holt entered without knocking. He looked at the uniforms, the document cases, the memorandum on the table, and the nurse he had watched get humiliated that morning, and whatever composure he had been holding collapsed. "I need to make a statement," he said, "about something I did 30 minutes ago that I need to correct before it goes any further." Reyes pointed to a chair. "Sit down." He sat, and he talked. He told them about the Oakes Amendment. He told them about 3 other occasions when Rennick had instructed him to adjust post-operative notes. He told them about the informal policy among the surgical residents, never spoken aloud, never written down, but universally understood, that you did not question Rennick's documentation, you did not contradict his clinical assessments, and you did not, under any circumstances, go to administration with concerns about his practices. "Why not?" Reyes asked. "Because the last resident who did got transferred to a rural clinic in Wyoming and had his fellowship recommendation withdrawn. Everyone knows what happened to Dr. Vasquez. It's the first thing the senior residents tell you when you start your rotation." "Dr. Vasquez, what's the full name?" "Dr. Monica Vasquez. She was a 3rd-year surgical resident here about 18 months ago. She reported concerns about altered post-op documentation to the Department Quality Committee. Within 2 weeks, she was reassigned. She's at a critical access hospital in Sheridan now." Holt paused. "She's a better surgeon than most of the attendings here. She shouldn't be doing appendectomies in a 40-bed rural hospital. But that's where Rennick put her, and everybody understood the message." Reyes was writing rapidly. One of the civilian investigators had opened a laptop and was entering information into a database that Marin recognized as a federal case management system. Marin had been silent during Holt's entire account. She watched him the way she watched patients, reading vital signs that had nothing to do with blood pressure or heart rate. She saw the sweat on his temples. She saw the way his right leg bounced under the table. She saw the micro-expression of relief that crossed his face when he finished speaking, the particular lightness of a person who has set down something they've been carrying for too long. She also saw something else. She saw a young doctor who had made a mistake not because he was corrupt, but because he was afraid. And that distinction mattered, even when the mistake was serious, because Marin had spent enough time in enough terrible situations to understand that fear made people do things that shame couldn't undo, and that the only thing worse than making a bad decision under pressure was never getting the chance to correct it. "Dr. Holt," she said. It was the first time she'd spoken in 20 minutes. He looked at her. His eyes were wet. The vent adjustment this morning, the one Rennick yelled at me for, was it clinically appropriate? He nodded. It was textbook. His plateau pressures were trending toward injury threshold. You caught it before we did. And Sandra Oaks, my escalation, was it sufficient? It was more than sufficient. You flagged it twice and documented both times. The delay was... He stopped, swallowed. The delay was on me. I should have gone to Rennick immediately instead of waiting for him to cycle through his other cases. I prioritized his schedule over her vitals. That's on me. The room held that statement like a held breath. Thank you, Marin said. Nothing more. Pearson looked at Reyes. A wordless communication passed between them. The kind of exchange that happens between professionals who have worked together long enough to skip the translation step. Commander, Pearson said, I think it's time we spoke with the hospital's administrative leadership. Agreed. And Dr. Rennick? Rennick last. Why last? Because I want him to see it coming. The next 90 minutes reorganized the power structure of Elkhorn Valley Medical Center with the efficiency of a controlled demolition. Pearson and Reyes moved through the administrative wing like a weather system, pulling people into the conference room one at a time. Boyd Worthen first, then Joan Kemper, who had finally arrived from her budget meeting looking like a woman who had driven 90 miles per hour on a rural highway without knowing why, then the chief nursing officer, the compliance director, and 2 members of the hospital's board of trustees who happened to be in the building for an unrelated meeting. Each conversation followed the same pattern. Reyes presented evidence. Pearson asked questions. The person across the table realized at varying speeds that they were not in control of this situation and never had been. Boyd Worthen lasted 7 minutes before he asked for legal counsel. Reyes informed him that he was welcome to have an attorney present, but that the investigation would not pause while he arranged one. Joan Kemper lasted 12 minutes. She was smarter than Worthen, or at least more politically aware. And she spent the first 5 minutes asking careful questions designed to determine exactly how much the investigators already knew. When Reyes laid out the audit data showing 18 months of altered surgical outcome reports, Kemper's careful questions stopped. I want to be clear, Kemper said. I was not aware of any systematic alteration of medical records at this facility. Were you aware of the separation of 7 nursing and support staff members who raised concerns about documentation practices? Personnel actions are handled by department heads and HR. I don't review every 7 separations in 18 months, all from the same department, all following complaints about the same physician. You didn't notice a pattern? Kemper's mouth opened and closed. She looked like a fish that had just realized the water was gone. I want to cooperate fully with this investigation, she said. That's appreciated, Reyes replied in a tone that communicated very precisely that appreciation and trust were different things. The compliance director, a man named Garrett Pryor, who had held the position for 6 years, provided the most damaging testimony of all, though it took him a while to get there. He began with denials, progressed through qualifications, and eventually arrived at a place that looked like selective honesty, which was the most dangerous kind because it mixed truth and omission in ratios that required careful separation. I flagged concerns about surgical outcome reporting to Dr. Rennick directly approximately 14 months ago, Pryor said. What was his response? He told me the data was accurate and that any perceived anomalies were the result of his superior surgical technique. And you accepted that explanation? Pryor paused. I noted his response and moved on to other compliance priorities. You noted it in writing? Verbally? So there's no record of you raising this concern? No, there isn't. Mr. Pryor, do you understand that as compliance director, you are personally responsible for ensuring the accuracy of federally reported outcome data? Pryor understood. The color in his face said he understood very well. Marin sat through all of these interviews. She hadn't been asked to. She had simply remained in the room and nobody told her to leave, which she took as implicit permission from Pearson, who seemed to want her there for reasons he hadn't articulated. She listened to each administrator's version of events, and she measured the distance between what they said and what she had observed during 2 years of watching from the position of a person nobody thought was paying attention. The distance was considerable. By the time Pearson was ready for Rennick, the afternoon had turned gray outside the conference room windows. Storm clouds had moved in from the northwest, the kind of fast-building Montana weather that could drop the temperature 20 degrees in an hour, and the light in the room had shifted from bright to flat, casting everyone's face in the colorless pallor of an overcast sky. Rennick entered the conference room with the posture of a man who believed he was walking into a negotiation. He had changed into a fresh white coat. Marin noticed that, the vanity of it, the need to present authority even when the ground beneath that authority was already cracking. He looked at the uniforms, the document cases, the JAG commander, and sat down without being invited. Then he looked at Marin. The expression that crossed his face was complicated. It wasn't surprise. He had clearly been told she was in the room. It wasn't anger, though anger was in there somewhere, buried under layers of professional veneer. It was something closer to recalculation. He was looking at her the way you look at a chess piece that has suddenly moved to a square you didn't think it could reach. "Dr. Rennick," Pearson said, "thank you for joining us. I wasn't aware I had a choice." Rennick's voice was controlled, modulated. The voice of a man who had chaired hundreds of meetings and knew how to fill a room with tone alone. "I've been waiting for nearly 2 hours without explanation while my department operates without its chief. I trust there's a good reason." "There is. Commander Reyes will walk you through it." Reyes opened a folder, different from the one she'd shown the administrators. Thicker, more tabs, more color-coded flags. "Dr. Rennick, I'm Commander Elena Reyes, Navy Judge Advocate General's Corps, attached to a joint Army CID investigation under the authority of the Department of Defense Inspector General. We are conducting an investigation into systematic falsification of medical records at this facility in connection with federally funded veteran care programs." Rennick's expression didn't change, but his right hand, resting on the table, contracted by approximately 2 millimeters. Marin saw it. Pearson saw it. Reyes, who was watching his face and not his hands, did not, but she didn't need to. "I don't know what you've been told," Rennick said, "but I can assure you that the surgical department's documentation practices are rigorous and fully compliant with—" "Dr. Rennick, I'm going to stop you there." Reyes's voice didn't rise. It didn't need to. "I'm not here to listen to assurances. I'm here to inform you of the scope of this investigation and to give you an opportunity to respond to specific evidence. If at any point you wish to have legal counsel present, that is your right, and we will pause the interview until counsel arrives. Do you understand?" For the first time, something flickered across Rennick's face that looked like genuine uncertainty. He was a man who controlled rooms. He was sitting in a room he could not control, across from people who operated in a system where his title, his tenure, and his reputation carried exactly 0 weight. "I understand," he said. Reyes began. She started with the audit data, the statistical anomalies that had triggered the initial inquiry. She walked him through the numbers methodically, showing complication rates that were physiologically implausible, infection rates that contradicted the facility's own microbiology lab reports, and outcome scores that had been revised upward in the electronic medical record system at timestamps that consistently fell between midnight and 3 in the morning. "Can you explain why surgical outcome data at this facility is routinely modified between midnight and 3 a.m.? Reyes asked. "I can't explain what I'm not aware of. The modifications were made using your login credentials, Dr. Rennick." Silence. In 37 separate instances over the past 18 months, medical records were accessed and altered using your unique system ID and password. The changes consistently revised complication classifications downward, removed references to procedural delays, and eliminated nursing notes that documented intraoperative concerns. "Eliminated nursing notes," Marin said. She hadn't intended to speak. The words came out on their own, carried by 2 years of suspicion crystallizing into certainty. "That's why my charting on the Anderson case disappeared." Every head in the room turned toward her. "What Anderson case?" Pearson asked. Marin looked at Rennick. He looked back at her with something that was no longer contempt. It was something rawer than that. The expression of a man watching a wall he'd built begin to move. 11 months ago, Marin said, a patient named Roy Anderson, 68 years old, came in for an elective hernia repair. During the procedure, there was a complication, accidental bowel perforation. I documented the post-operative signs of peritonitis at the bedside and flagged the surgical team. When I came back the next shift, my nursing notes from that encounter were gone from the chart. Just gone. The system showed no record of my documentation. I reported it to Donna Pelfrey, who reported it to the nursing supervisor, who told us it was probably a system glitch. It wasn't a system glitch, Reyes said. I know that now. Reyes turned back to Rennick. Dr. Rennick, Roy Anderson developed post-operative sepsis following his hernia repair and required emergency reoperation. The outcome report for that procedure lists the complication as unavoidable surgical risk and makes no reference to a bowel perforation or delayed recognition of peritonitis. Nursing documentation that would have contradicted that characterization was deleted from the system using your credentials. Rennick was quiet for 10 seconds. It was the longest 10 seconds Marin had experienced since the last time she'd performed CPR, and the quality of the silence was similar, heavy, pressurized, full of the possibility of something ending. I'd like to speak with my attorney, Rennick said. That's your right. We'll pause the interview. Reyes closed the folder. However, I need to inform you that based on the evidence collected to date, this investigation has sufficient grounds to recommend criminal referral to the United States Attorney's Office for charges including falsification of federal medical records, fraud in connection with federally funded healthcare programs, and obstruction of a federal investigation. Those are preliminary designations and may expand as the investigation continues. Rennick's face had gone the color of old paper. The silver confidence that he wore like a second skin had evaporated, and what was left underneath was smaller than anyone in the building would have expected. He looked at Marin one more time, a long look. The kind a man gives to the thing he dismissed that turned out to be the thing that mattered most. Then he stood, and for the first time since Marin had known him, Theodore Rennick left a room without saying a word. The door closed behind him. The room exhaled. Pearson walked to the window. The storm had arrived. Rain was hitting the glass in sheets, turning the parking lot into a gray blur punctuated by the dark shapes of military vehicles that hadn't moved since morning. He'll lawyer up within the hour, Pearson said. His type always does, and the lawyer will tell him to cooperate because the evidence is overwhelming, but he won't cooperate because men like Rennick don't know how to admit they're wrong. It's not in their wiring. That's not our problem, Reyes said. We have the records, we have the audit trail, we have Dr. Holt's testimony, and now we have Ms. Calloway's account of the Anderson case, which gives us a named incident with a named witness and deleted documentation. That's enough for the U.S. attorney. Marin was still sitting at the table. She hadn't moved during Rennick's entire interview. Her posture was the same controlled stillness she'd maintained all day, but something about her expression had changed, a softening around the edges that wasn't relief exactly, but might have been the first stage of it. Ms. Calloway, Reyes said, I want you to understand something. Your testimony today has been extraordinarily valuable. The specificity of your recall, the clinical detail, the documentation habits you maintained, those are not common. Most witnesses in cases like this remember feelings. You remember facts. That distinction is going to matter when this reaches prosecution. I remember facts because I was trained to remember facts, Marin said quietly. Not here. Somewhere else. Reyes looked at Pearson. Pearson gave a barely perceptible nod. I've read your service record, Reyes said. What I was permitted to read of it, which was about 60% of the total file. The other 40% is redacted at a level I don't have clearance for. She paused, letting that sink in. You were an exceptional soldier, Ms. Calloway. You are clearly an exceptional nurse, and what happened to you this morning was a failure of institutional accountability that this investigation will address directly. Marin didn't respond to the compliment. She had never known what to do with compliments. They felt like gifts handed to someone standing in a room with no shelves. What happens now? She asked. Pearson turned from the window. Now we secure the records, depose the remaining staff, and coordinate with the U.S. Attorney's Office. The administrative suspension against you will be rescinded by end of day. I'll see to that personally. And tomorrow morning, Commander Reyes and her team will begin a full forensic audit of every surgical case Rennick has overseen in the past 3 years. 3 years, Marin repeated. That's hundreds of cases. 247, according to the hospital's procedure logs, Reyes said. Every single one will be reviewed. The scope of that number sat in the room like something physical. 247 patients whose records might have been altered. 247 families who might learn that the outcome they were told about wasn't the outcome that actually occurred. 247 potential threads leading to a truth that had been systematically buried by a man in a white coat who had confused his authority with infallibility. Marin stood. Her legs were stiff. She'd been sitting for hours without realizing it, something she hadn't done since debriefings in a different life. "I need to check on Sandra Oaks," she said. "You're technically still suspended," Pearson pointed out. "I'm not going to treat her. I'm going to check on her. There's a difference." He didn't argue. He had learned 4 years ago in circumstances far worse than these that arguing with Marin Calloway when she had decided to do something was an exercise in futility. She left the conference room and walked down the hallway toward the post-operative recovery unit. The hospital felt different now, not quieter exactly, but heavier. Staff members she passed looked at her with expressions she couldn't read. Some looked away, some didn't. A young CNA she barely knew stopped in the middle of the hallway and said, "We heard what happened. We're glad you're still here." Then she walked away before Marin could respond. Sandra Oaks was in Recovery Bay 2, conscious but groggy, with an IV in each arm and a surgical drain protruding from her abdomen. Her color was better than it had been that morning, but still not good. The particular gray-yellow of someone who had lost too much blood and was being replenished by bags rather than biology. Marin stood at the doorway. She didn't enter because she wasn't Sandra's nurse anymore, and walking in would have complicated things for whoever was. Sandra turned her head, her eyes focused with difficulty. "You're the one," she said, her voice cracked and thin. "From this morning. You kept coming to check on me." "I did. Someone said they took you away." "They did. I came back." Sandra's eyes closed. "I'm glad. You were the only one who noticed." Marin stood there for another 30 seconds, watching Sandra breathe, the steady mechanical rhythm of a woman who was alive because eventually the right thing had happened. Not fast enough, not cleanly enough, but eventually. She turned away from the doorway and nearly walked into Colonel Pearson, who was standing in the corridor with the sealed envelope from the briefcase. "You left this on the table," he said. "I know. I'm going to leave it in the administrative office. When you're ready, if you're ever ready, it'll be there." Marin looked at the envelope. She could see the edge of the classification stamp through the corner of the seal. She knew what was inside: commendations, citations, a record of service that documented things she had done in places she would never name, for people who would never know her real story. She didn't reach for it. "There's something I need to tell you," Pearson said. "And I should have said it earlier, but the timing wasn't right, and the investigators needed to do their work first." He paused, and something shifted in his bearing, a slight loosening of the command posture, a crack in the professional surface. "When I woke up in Landstuhl 4 years ago, the first thing I asked was the name of the medic. They told me you'd already been discharged, that you'd processed out so fast the paperwork wasn't even filed correctly. I spent 4 months in recovery, and every single day I asked someone, anyone, to find you. I didn't want to be found. I know, and I respected that for a long time. But then I got reassigned to SOCOM headquarters, and I pulled the after-action reports from that night, and I realized something that changed my mind." His voice dropped. "The people who wrote those reports, the commanders, the analysts, they reduced what you did to 3 paragraphs of operational summary. 3 paragraphs for 11 casualties treated, 6 soldiers saved, a thoracotomy performed under fire with no surgical backup. They filed you away like a logistics note, and then you filed yourself away, and the two things together felt like the same kind of erasure, and I decided that someone needed to push back against that, even if the person being erased was the one doing the erasing." Marin said nothing for a long time. The hallway was empty except for the two of them and the distant beep of monitors and the rain against the windows. "I didn't leave because I wanted to be erased," she said finally. "I left because I couldn't carry it anymore. What I saw, what I did, the gap between how it felt to save someone and how it felt afterward, when the adrenaline stopped and you were just a person standing in a room with blood on your hands that belonged to someone else." She paused. Nursing was supposed to be the version of saving people that didn't require that gap, where the stakes were lower and the nights were quieter and you could go home and sleep without... She stopped. Without what? Without checking the corners of the room first. Pearson didn't say anything. He didn't need to. He was a special operations colonel who had spent 23 years in environments where checking the corners of the room wasn't a symptom, it was survival. He understood what she was describing because he lived inside the same architecture. The offer I mentioned, he said, it's not a recall to service, it's not a recruitment. It's a position, civilian, DoD affiliated, heading a new medical oversight program designed to prevent exactly what happened at this hospital. You'd be reviewing facilities, training staff, building systems that catch the Rennicks before they bury the evidence. It's not frontline medicine. It's not combat. But it's the kind of work that uses everything you are. The medic, the nurse, the person who sees things other people miss. He held out a business card, plain government issue with a phone number and an email address and no agency logo. You don't have to answer now. You don't have to answer ever. But I want you to have the option. Marin took the card. She held it between her thumb and forefinger, feeling the weight of it, which was nothing, physically, and everything else in ways she wasn't ready to measure. I need to go home, she said. I haven't eaten since 5:30 this morning, and I'm starting to see spots. Pearson almost laughed. Almost. Go. We'll be here through tomorrow at least. The forensic audit starts at 0600, and I expect Rennick's attorney to show up around the same time demanding to know things I'm not obligated to tell him. Marin pocketed the card. She walked down the hallway toward the main exit, passing the lobby where, 12 hours ago, a colonel had saluted her and the world she'd built had cracked open. The lobby was empty now except for a security guard, the same young guard who had walked her out that morning. He looked at her as she passed. He opened his mouth to say something, changed his mind, and simply held the door open for her. She stepped into the rain. It was cold, Montana cold, the kind that soaked through scrubs in 30 seconds and made your bones feel like they belonged to an older person. Her car was where she'd left it. The cracked windshield caught the rain in patterns that looked almost deliberate, like a map of somewhere she hadn't been. She was unlocking the door when her phone rang. The number was local but unfamiliar. She answered out of habit. Nurses always answered unfamiliar numbers because unfamiliar numbers were sometimes the hospital calling from a line you didn't have saved. Marin Calloway. Yes. Ms. Calloway, this is Angela Britton. I'm a reporter with the Briarfield Gazette. I understand there was a significant military presence at Elkhorn Valley Medical Center today and that a nurse was suspended and subsequently reinstated in connection with a federal investigation. Would you like to comment? Marin stood in the rain with the phone pressed to her ear and her car keys in her hand, and she felt the entire day. The suspension, the soldiers, the conference room, Rennick's face, Sandra Oakes's breathing, Pearson's card in her pocket, compress into a single, blinding point of clarity. The story was about to go public, and the people who had counted on silence were about to discover that silence, once broken, doesn't just crack. It shatters in every direction at once, and there is no surgeon skilled enough to stitch it back together. Marin didn't answer the reporter's question. She stood in the rain for 3 seconds with the phone against her ear, the water running down her neck and pooling in the collar of her scrubs. And then she said the only thing that mattered. No comment. She hung up, got into her car, and sat in the driver's seat without starting the engine. The windshield was a wall of water. The parking lot was invisible behind it. She could hear the idling engines of the military vehicles somewhere to her left, a low mechanical hum that vibrated through the Subaru's thin frame, and she could feel her heartbeat in her fingertips, faster than it should have been, faster than it had been all day, which told her something important about the difference between facing a federal investigation and facing a journalist. The investigation was a system. Systems had rules. Journalists had deadlines, and deadlines made people do things that rules couldn't predict. She started the car and drove home. Home was a one-bedroom apartment above a hardware store on Briarfield's main street, 3 blocks from the railroad tracks and 11 minutes from the hospital. The apartment had come furnished in the way that cheap rentals come furnished: a couch that smelled like previous tenants, a kitchen table with one wobbly leg, and a bed frame that creaked every time she rolled over. She had added almost nothing in 2 years. A reading lamp, a coffee maker, a single framed photograph on the nightstand that she had turned face down 6 months ago and hadn't picked up since. She changed out of her wet scrubs, ate a bowl of cereal standing at the kitchen counter because sitting down felt like a commitment she wasn't ready to make, and then sat on the couch in sweatpants and a flannel shirt and stared at the wall for approximately 45 minutes without thinking about anything specific. This was something she had learned to do a long time ago, emptying the operational buffer, her old unit psychologist had called it, though the psychologist had used more clinical language. The point was to let the day's inputs settle without processing them, the way you let sediment fall in a glass of water before you tried to see through it. At 7:15, her phone buzzed, a text from Donna Pelfrey. "Are you okay?" Marin typed back, "I'm fine. How's Oaks?" "Stable. Vitals improving. She's been asking about you. Tell her I'll come by tomorrow. Are you coming back?" Marin looked at the question for a long time. She didn't answer it because she didn't know the answer, and typing something non-committal felt dishonest in a way she wasn't willing to be. Not with Donna, who had stood in that hallway with her jaw trembling and her fists clenched and said nothing, and who was now texting her at 7:15 on a Monday evening because guilt and loyalty were sitting on opposite sides of her conscience, and neither one was winning. She set the phone down and went to bed. She slept for 3 hours. At 10:30, she woke up to the sound of her phone ringing again. Same unfamiliar local number. Angela Britton. She silenced it and lay in the dark, listening to the rain, which had not stopped, and to the freight train that passed through Briarfield every night at 10:42 with a whistle that rattled her windows. When the train was gone and the rain was the only sound left, she closed her eyes and tried to sleep again. But her mind had shifted into the mode she couldn't control, the one where every detail from the day replayed in high-definition clarity, not as memories but as operational data, sorted and cross-referenced and analyzed for threats she might have missed. Rennick's face when the evidence was laid out, the way his right hand had contracted, the 2mm tell that separated a man's public composure from his private collapse. She had read that contraction the way she used to read the body language of people in situations where reading wrong meant dying, and what it had told her was that Rennick was not surprised by the evidence. He was surprised by the timing. He had known, on some level, that the records were vulnerable. He had been operating under the assumption that vulnerability was theoretical, a risk managed by institutional inertia and the silence of people too afraid to speak. What he had not anticipated was someone arriving from outside the system with the authority to look. She also replayed Pearson's words in the hallway. The offer. Civilian, DOD affiliated, medical oversight, the kind of work that uses everything you are. She turned the card over in her mind the way she had turned it over in her fingers, reading the plain text, measuring the space between what it said and what it meant. What it meant was a return to the world she had left. Not the combat, not the forward operating bases and the smell of cordite and the sounds she heard when the apartment was too quiet. But the infrastructure around that world. The systems, the protocols, the chain of command that ran from surgical bays to Senate hearings. She had left all of it. She had walked away from the commendations and the clearances and the people who knew what she'd done, and she had chosen a life so ordinary that nobody would ever ask her the questions she couldn't answer. Pearson was asking her to choose again. She fell asleep at 1:17 and woke at 4:52, 7 minutes before her alarm. The rain had stopped. The air coming through the cracked bedroom window was cold and sharp, thinned by altitude in the way that mountain air always was in this part of Montana. And for a few seconds she lay still and felt the particular weightlessness of a person suspended between two versions of their own life, unable to reach the ground in either one. Then she got up, made coffee, and drove to the hospital. She arrived at 5:40, early enough that the parking lot was mostly empty except for the night shift cars and the military vehicles, which were still parked in the same positions they'd occupied the previous day. Two soldiers stood near the communications truck, drinking coffee from paper cups and talking quietly. One of them nodded to her as she passed. She nodded back. The front entrance was unlocked, but the lobby was empty except for a different receptionist, a night shift woman named Pat, who looked at Marin with wide eyes and said, "I didn't think you were coming in. I'm not cleared for clinical duty yet. I just need to check on a patient." They said, "There's a note here that says your suspension was rescinded as of 6 p.m. yesterday." Boyd Worthen signed it. Marin processed that. Rescinded. Not pending review, not modified, not conditionally lifted. Rescinded. The word meant something legally specific. It meant the action was nullified, treated as though it had never occurred. Someone had applied considerable pressure to make that happen within 8 hours, and the someone was almost certainly Pearson. "Okay," she said. "Then I'm back on shift. Your schedule has you off today. You're not on the board until Wednesday." I'll check with the charge nurse. She walked toward the emergency department. The hallway lights were dimmed to night shift levels, casting that particular blue-gray tint that made every hospital look the same at 5 in the morning. She passed the conference room where yesterday's interviews had taken place. The door was open, the table cleared, the chairs pushed back. A fresh pot of coffee sat on the sideboard, which meant the investigative team was already in the building. The ED was quieter than yesterday, but not empty. 3 patients in the bays, 2 nurses at the station. The night shift charge nurse, a man named Marcus, whom Marin liked because he never asked unnecessary questions, looked up from a chart when she appeared. "You're not supposed to be here," he said. "Suspension was rescinded. I heard. I still wasn't expecting you at 5:40 in the morning." He studied her for a moment. "Oaks is in recovery bay too, same spot. She slept most of the night. Vitals are trending up." "Thank you." She went to Sandra Oaks's bedside. Sandra was asleep, her monitors showing a heart rate of 74 and oxygen saturation of 96%, both significantly better than 24 hours ago. The surgical drain was producing less output, which meant the internal bleeding had been controlled. Her color was still off, but improving, the gray-yellow shifting toward something that approximated living skin rather than something you'd find in a specimen jar. Marin checked the IV pump, the drain output, the medication schedule. All current, all correct. The night nurse had done good work. She pulled a chair to the bedside and sat for a few minutes, not because there was anything clinical to do, but because the simple act of sitting with a patient who was getting better was the antidote to everything else. At 6:15, Sandra opened her eyes. "You're back," she said. Her voice was stronger than yesterday, but still rough. "I'm back. What time is it?" "A little after 6. "In the morning?" "Yes." Sandra blinked. "You're here at 6 in the morning to check on me, and you're not even on duty?" "I'm on duty now, apparently." "You're strange." Sandra closed her eyes again, but she was smiling. It was a tired, lopsided, post-surgical smile, the kind that cost effort and meant something because of it. Marin stayed for another 5 minutes, then left the recovery unit and walked back toward the ED. She was passing the administrative wing when she heard voices, not raised, but pointed, the kind of voices that carry around corners because the people speaking them have stopped caring about volume. She recognized one of them immediately. Rennick. The second voice was unfamiliar, male, clipped, lawyerly. The third was Pearson's. Marin stopped walking. She stood in the corridor junction where the administrative hallway met the main hall, not quite out of sight but not quite visible either, and listened. She wasn't eavesdropping, she was performing a threat assessment. The distinction mattered to her even if it wouldn't matter to anyone else. "Completely unacceptable," the unfamiliar voice was saying. "My client has cooperated voluntarily with your inquiry, and now you're telling me that you intend to suspend his clinical privileges before the investigation is complete? That's punitive action without due process. Your client's clinical privileges are a matter between him and this hospital's credentialing committee," Pearson replied. "We're not suspending anything. We're recommending that the hospital take interim protective measures while the federal audit is in progress. That recommendation is standard procedure for any facility under OIG investigation. And I'm telling you that Dr. Rennick has 31 years of unblemished—" "Mr. Callister," Pearson's voice dropped half a register. "I have a stack of evidence documenting 18 months of systematic record falsification tied directly to your client's login credentials. I have testimony from a resident who states your client instructed him to amend a patient record less than 24 hours ago. And I have 7 former employees who were separated from this facility after raising concerns about practices in your client's department. Your client's record is not unblemished. It is at this moment the subject of a federal criminal referral. So I would suggest that the conversation we should be having is not about Dr. Rennick's privileges, but about how Dr. Rennick intends to respond to the evidence against him." Molly said, "Silence. The kind that has texture, thick, layered, heavy with things not being said." Then Rennick spoke. His voice was different from anything Marin had heard from him before, stripped of performance, flat. The voice of a man who had spent the night understanding something he hadn't been willing to understand the day before. "I want to see the Oaks report," he said. "The original, not the amended version." "Which amended version?" Reyes's voice now, from somewhere deeper in the room. The one filed by your resident under your instruction? Or the one filed before that, which was also modified from the original nursing documentation? Another silence. Dr. Rennick, Reyes continued, we have 3 versions of the Sandra Oaks operative report in the system. Version 1, filed at 11:07 yesterday morning, accurately reflected the surgical findings and the timeline of events. Version 2, filed at 11:32, removed references to the delayed intervention and altered the cause of delay designation from physician response time to nursing communication failure. Version 3, filed at 11:51 by Dr. Holt at your instruction, added additional language attributing the delay specifically to the bedside nurse. The metadata timestamps, the login records, and Dr. Holt's sworn statement all confirm this sequence. Dr. Holt gave a sworn statement? He did. Voluntarily. The word voluntarily landed with the force of a physical blow. Marin could hear it in the quality of the silence that followed, the silence of a man realizing that the system of loyalty and fear he had built was dissolving, and that the people he had counted on to stay quiet were choosing the opposite. I need a moment with my client, the lawyer said. Take all the time you need. We're not going anywhere. Marin heard footsteps moving toward the conference room door. She stepped back around the corridor junction before the door opened, pressing herself flat against the wall, the way she had once pressed herself flat against the concrete wall of a bombed-out building while a firefight erupted 30 meters away. Different contact, same reflex. The muscle memory didn't distinguish between threats to her body and threats to her equilibrium. The door opened. Rennick and his lawyer emerged and turned in the opposite direction, heading toward the far end of the administrative wing, where a small office had apparently been made available for private consultation. They passed within 20 feet of her without seeing her. Rennick's gait was wrong, shorter stride, lower head, the posture of a man carrying something heavier than his frame was designed for. His white coat was wrinkled. He had been wearing it for over 12 hours. Marin waited until they were gone, then continued to the emergency department. The day shift was arriving. Donna came in at 6:45 looking like she hadn't slept, which she probably hadn't. She saw Marin at the nursing station and stopped walking. You came back. I came back. I heard the suspension was rescinded. It was. Donna stood there for a moment, holding her badge in one hand and her coffee in the other, and then she said something that Marin hadn't expected. I'm sorry I didn't say anything yesterday. When they were walking you out, I wanted to. Don't. Marin held up a hand, not dismissive, firm. You have 3 kids, Donna. You've been here 19 years. He could have made your life impossible, and you know it. I don't hold it against you, and I never will. That doesn't make it right. No, it doesn't. But being right and being able to afford rent aren't the same thing, and I'm not going to pretend they are. Donna's eyes filled. She blinked hard, twice, and the tears didn't fall. 19 years of emergency nursing had given her extraordinary control over her lacrimal ducts. But they were there, and Marin saw them, and the scene was enough. They went to work. The morning was busy, but not chaotic. The bus accident patients from the previous day were either discharged or transferred to longer-term care. New cases came in, a rancher with chest pain who turned out to be having a STEMI and went directly to the cath lab, a teenager who had fractured her wrist skateboarding and was more upset about missing practice than about the injury, an elderly woman with pneumonia whose oxygen levels were low enough to warrant admission, but not low enough to panic. Routine, by emergency department standards. Marin moved through the shift the way she always did, efficiently, thoroughly, without wasted motion. But there was something different in the way people looked at her now. Not deference exactly, something more like recalibration, the adjustment that happens when a known quantity reveals an unknown dimension. At 9:30, the first wave hit. Marcus, who had stayed past his shift to help with the transition, came back from a break room trip looking like he'd seen his own ghost. Marin, you need to see this. He held up his phone. On the screen was the Briarfield Gazette's website, and the headline read, Federal Investigators Probe Elkhorn Valley Medical Center. Chief Surgeon under scrutiny for alleged record falsification. Angela Britton's byline. Published at 9:12 a.m. Marin took the phone and scanned the article. It was thorough in the way that small-town journalism could be when the reporter was competent and motivated. Britain had confirmed the military presence through public records requests and eyewitness accounts, identified the OIG investigation through a source she described as a federal official familiar with the matter, and included a paragraph about a nursing staff member who was publicly suspended and subsequently reinstated within hours, raising questions about the circumstances surrounding the personnel action. What? The article didn't name Marin. It didn't need to. Elkhorn Valley had 300 employees. By noon, every one of them would know who the unnamed nurse was. "There's more," Marcus said. He scrolled down. The Gazette article had been picked up by a regional wire service. A television station in Billings had posted a summary on its website. A healthcare industry blog had linked to it with the headline, "Another Rural Hospital Fraud Case. How many more are hiding?" "It's going regional," Marin said. "Give it 6 hours and it'll go national. DOD investigation, falsified records, veteran care funding. That's a story every network will want." Marin handed the phone back. She felt the floor tilt slightly beneath her, not physically but psychologically. The sensation of a small, controlled life suddenly connected to a much larger system. She had spent 2 years making herself invisible. In approximately 6 hours, if Marcus was right, she was going to become the opposite. She went back to work because work was the only thing she controlled. At 10:15, Joan Kemper appeared in the emergency department. The hospital director had changed clothes since yesterday, but not demeanor. She looked like a woman standing in front of a dam that had already cracked, holding a bucket. She found Marin in Bay 3, where Marin was adjusting the oxygen flow on the pneumonia patient. "Ms. Calloway, can I speak with you?" "I'm with a patient." "It's important." "So is her breathing." Marin finished adjusting the cannula, documented the new flow rate, and stepped out of the bay. Kemper was standing in the hallway with her arms crossed, the way administrators stand when they're trying to project authority, but have recently been informed by federal investigators that their authority is largely fictional. "I want you to know," Kemper said, "that the hospital is fully cooperating with the federal investigation and that your reinstatement is effective immediately and unconditional." Boyd Worthen already processed that last night. "Yes, but I wanted to communicate it to you personally and to assure you that the hospital—" "Ms. Kemper." Marin's voice was quiet, but it stopped Kemper mid-sentence, the way a hand on a steering wheel stops a car. "Are you here because you're concerned about me, or because your legal counsel told you to create a paper trail showing that you personally communicated my reinstatement in case I file a wrongful termination claim?" Kemper's mouth compressed into a thin line. The answer was written on her face as clearly as if she'd held up a sign. "Both," she said, and to her credit, the honesty surprised even her. "I'm not filing a claim. I'm not talking to reporters. I'm not interested in making this about me, but I need you to understand something." Marin stepped closer, not aggressively, just close enough that Kemper couldn't look away without physically turning her head. 7 people were pushed out of this hospital for doing what I did yesterday. 7. I knew some of them. They were good nurses and good techs, and they deserved better than what happened to them. Whatever the investigation finds, whatever happens to Rennick, those 7 people matter. They don't stop mattering because the federal government got involved. Bam. Kemper looked at her for a long time. The expression on her face was complicated, part defensiveness, part shame, part the dawning recognition that institutional accountability is not a policy document, but a series of individual choices, each one made by a person who could have chosen differently. "I hear you," Kemper said. "Hearing and doing are different things." "Yes," Kemper said. "They are." She left. Marin went back to her patients. At 11:45, the second wave hit, and this one was a tsunami. Donna was at the nursing station entering medication orders when her phone started buzzing with texts from every nurse she knew in the state. She read the first one, then the second, then held the phone out toward Marin without speaking. A national news network had picked up the story. Not just the investigation, the story behind the investigation. Someone, somewhere, Marin would never find out who, had leaked enough details to construct a narrative that went beyond hospital fraud and into territory that made it irresistible to cable news. A decorated combat medic, hidden in plain sight as a civilian nurse, humiliated and fired by the very surgeon whose corruption she had unwittingly helped expose, rescued by a military colonel whose life she had saved on a classified mission years earlier. The details were imprecise. Some were wrong. The outline was close enough to be recognizable. Marin read the summary on Donna's phone and felt something she hadn't felt in a long time, the sensation of losing control of her own narrative. In the military, her story had been classified. In civilian life, her story had been invisible. Now it was neither. It was public, partial, and being shaped by people who didn't know her and would never ask. "My phone's been ringing since 10, Donna said. 3 reporters, a TV producer from Billings, and someone from a veterans advocacy group who wants to know if you're willing to speak at an event in D.C. I'm not willing to speak anywhere. I told them that. They asked me to ask you anyway." Marin put Donna's phone face down on the counter. "I need to not think about this for the next 4 hours. Can we do that?" "We can try." They tried. It lasted approximately 40 minutes. At 12:20, Colonel Pearson found Marin in the supply closet. She was restocking gauze pads, which was a task she could do with her hands while her mind processed the fact that her life was unraveling in a direction she hadn't anticipated. The supply closet was 6 feet by 8 feet, lit by a single fluorescent tube, and smelled like adhesive bandages and rubbing alcohol. It was, at that moment, the only room in the building where nobody was looking for her. Pearson stood in the doorway. He took in the scene. The nurse on her knees organizing gauze on a metal shelf, the fluorescent light casting shadows under her eyes, the efficiency of her movements masking the tension in her shoulders, and he waited until she acknowledged him. "I know about the news coverage," she said without looking up. "I assumed you did." "Did your team leak it?" "No. We've opened an inquiry into the source. My best guess is one of the hospital administrators or a staff member who was present during yesterday's events. Someone talked to Britain, and Britain's article created enough interest for the Nationals to start digging. Can you stop it?" "No. Nor would I if I could. The investigation is federal, and the public interest component is legitimate. What I can do is ensure that your name, your service record, and your classified history remain protected. Nothing from your military file has been or will be released without your consent. My name is already being figured out. There's one nurse at this hospital who was suspended yesterday and reinstated the same day. It won't take a journalist more than 20 minutes to identify me." "Probably less," Pearson admitted, "which is why I'm here. I want to offer you something that isn't on the business card." Marin stopped arranging gauze. She sat back on her heels and looked up at him. "Protective detail," she said, and the way she said it, flat, slightly skeptical, laced with the kind of dark humor that only people who have lived in genuinely dangerous situations deploy, made Pearson shake his head. "Not protective detail. Operational cover. If you want it, I can have you temporarily reassigned to the DoD investigation team as a civilian medical consultant. It gives you a federal employment designation, which triggers privacy protections that make it significantly harder for media outlets to access your personnel information. It also gives you a reason to be in this building that isn't nurse who got fired and unfired, which, based on what I know about you, is a label you'd rather set on fire than wear." Marin considered this. The supply closet hummed around them, the fluorescent light, the ventilation system, the distant beep of monitors on the other side of the wall. She could smell gauze and antiseptic and the particular soap the military used that she hadn't smelled in 2 years and that hit her nervous system like a password unlocking a file she'd encrypted. "If I take the consultant role," she said, "do I stop being a nurse?" "No, it's concurrent. You'd maintain your clinical position and add the federal designation. The investigation needs a clinical advisor anyway, someone who understands bedside documentation practices, nursing workflow, and how records can be altered without triggering automatic flags." "Reyes asked me this morning if I knew anyone qualified. I told her I was standing in a supply closet talking to the most qualified person in the building." "You weren't standing in the supply closet when she asked." "I'm paraphrasing." The ghost of a smile crossed Marin's face. It lasted less than a second, and it wasn't really a smile, more like the muscle memory of one, the way a pianist's fingers move over a table because the hands remember even when the music isn't playing. "I'll do it," she said, "but I have conditions." "Name them." "First, I don't talk to press. Not today, not during the investigation, not after. My name doesn't appear in any public-facing documents." "Done." "Second, Sandra Oakes. She's the patient Rennick delayed surgery on. She needs to be informed about what happened to her records, the real version, not the institutional version. She deserves to know that the delay in her care was documented, erased, and then blamed on a nurse who was trying to save her. That's something the investigation will need to coordinate with the hospital, but I agree in principle. I'll make sure it happens. Third, Marin paused. Monica Vasquez, the surgical resident Rennick exiled to Wyoming for reporting concerns. Whatever comes out of this investigation, she needs to be part of the resolution. She lost her fellowship because she told the truth. That can't just be a footnote in a federal report. Pearson looked at her steadily. You know I can't promise specific personnel outcomes. I'm not asking you to promise. I'm asking you to prioritize. There's a difference. There is. He nodded. Agreed. Marin stood, brushed off her knees, and picked up the box of gauze she'd been shelving. When do I start? You already have. Reyes wants you in the conference room at 1300 to review the first batch of surgical records from the forensic audit. She's got 47 cases queued, and she needs someone who can distinguish between legitimate documentation amendments and the kind that smell wrong. 47 by 1 o'clock? She's efficient. She's terrifying. Both. Pearson stepped aside to let her out of the closet. One more thing. The business card I gave you yesterday, the position I described, that offer doesn't expire today or next week. It'll be there when you're ready. Marin walked past him into the hallway, carrying the gauze and the weight of a decision she had just made. The decision to stop being invisible. Not because she wanted to be seen, but because the alternative had become untenable. Hiding had been a survival strategy. It had worked for 2 years. But survival strategies designed for one environment become liabilities in another, and the environment had changed. Rennick had changed it by suspending her. Pearson had changed it by finding her. Angela Britton and every journalist who followed had changed it by dragging the story into a space where hiding wasn't safety. It was absence, and absence looked like complicity when people were counting on you to be present. She delivered the gauze to the supply station, told Donna she'd be in the administrative wing for the afternoon, and walked toward the conference room at 12:50 with the posture of someone who had made peace with something without quite understanding what the peace would cost. Commander Reyes was waiting with a table full of files, a laptop displaying the hospital's electronic medical record system, and a legal pad already half filled with notes and handwriting so precise it looked typeset. Ms. Calloway, thank you for agreeing to consult. Marin is fine. Marin, I've pulled 47 surgical cases from the past 18 months that the audit algorithm flagged for documentation anomalies. I need you to review each case record and identify any discrepancies between the documented clinical narrative and what you would expect based on the procedure type, patient presentation, and standard nursing documentation protocols. You want me to find the lies? Reyes looked up from her legal pad. The faintest trace of approval crossed her face. The expression of a JAG officer who appreciated precision in others because she demanded it in herself. Yes. I want you to find the lies. Marin sat down and opened the first file. The work was meticulous and ugly. Each case was a small story. A patient who had come to Elkhorn Valley trusting that the people who treated them would tell the truth about what happened, and a record that betrayed that trust in ways ranging from subtle to brazen. Some alterations were minor, a complication reclassified from procedural to patient-related, shifting responsibility from the surgical team to the patient's own anatomy. Others were significant. Entire nursing assessments deleted, post-operative timelines compressed to eliminate gaps that would have revealed delays, medication errors documented and then redocumented in language that obscured what had actually gone wrong. Marin worked through 12 cases in the first hour. She flagged discrepancies with clinical annotations, noting where the documentation language shifted from real-time nursing shorthand to the smoother, more polished prose that characterized after-the-fact revisions. She identified 3 cases where vital sign trends had been altered, not the values themselves, but the timestamps, creating the impression that deterioration had been recognized earlier than it actually was. This one, she said, pushing a file toward Reyes. Case 31, appendectomy with post-op abscess formation. The nursing notes from the first 12 hours are gone, completely deleted. The surgical note says the abscess was identified on post-op day 2 during routine assessment, but the lab work from post-op day 1 shows an elevated white count and a CRP that was already climbing. Someone was documenting the signs of infection on day 1. and that documentation was removed to make it look like the surgical team caught it on day 2 through their own assessment. Could you prove the deleted documentation existed? The lab orders prove it. The white count was drawn at 0600 on post-op day 1. Somebody ordered that lab. If it was a physician, there'd be a corresponding physician note. If it was a nurse acting on a standing protocol, there'd be a nursing assessment. Neither exists in the current record, but the lab order and result are still in the system because lab data runs on a separate platform that Rennick apparently didn't have access to alter. Reyes picked up the file. Her eyes moved across the pages with the speed of someone who had been trained to read legal documents the way snipers were trained to read terrain. That's a gap we can prove, she said. The lab order is the ghost. It points to documentation that should exist and doesn't. There are more, Marin said. I found similar patterns in 4 of the 12 cases I've reviewed so far. Lab orders or imaging orders that correspond to clinical assessments that have been deleted from the nursing record. The labs and the images are still in the system because they're generated by different departments with different access controls. Rennick could alter surgical notes and nursing documentation, but he couldn't reach radiology or pathology without leaving additional traces. Reyes was writing rapidly. Can you map every case where this lab versus documentation discrepancy exists? Give me the full data set and I can map it by tomorrow morning. You'll have it by 3. They worked through the afternoon. At 2:30, one of the civilian investigators knocked and entered with news that changed the temperature of the room. Commander, we just received a call from the Montana State Medical Board. They've been contacted by Dr. Rennick's attorney requesting an emergency procedural review of the investigation's authority to recommend suspension of clinical privileges. Reyes looked up. He's going to the state board to block us? His attorney is arguing that the federal investigation doesn't have jurisdiction over state-licensed medical privileges and that any recommendation to suspend amounts to an overreach of federal authority. That's a stalling tactic, Pearson said from the doorway. He had appeared without anyone noticing, which was a trick Marin recognized because she could do it too. He knows the state board can't override a federal investigation, but he can use the procedural challenge to delay the privilege suspension by 48 to 72 hours. Why does he want 48 hours? Marin asked. Everyone looked at her. If the state board challenge delays the suspension, he retains system access for another 2 to 3 days. He can't alter the records we've already pulled, but there are cases we haven't pulled yet. The ones from before 18 months ago that fall outside the current audit window. If he gets back into the system before we expand the audit scope, he can clean anything we haven't looked at. The room went very quiet. Reyes turned to the investigator. How quickly can we expand the audit to cover 36 months instead of 18? The hospital's IT team would need to extract the additional records. With cooperation, 48 hours. Without cooperation, get Kemper on the phone. Tell her we're expanding the scope and we need her IT department's full cooperation immediately. If she pushes back, remind her that obstruction of a federal investigation carries its own consequences. The investigator left. Reyes looked at Pearson. We need to lock his credentials today, before the state board responds to his attorney. I'll speak with Kemper directly. System access is a hospital security decision, not a medical licensing decision. They can revoke his login without touching his medical privileges. Do it now. Pearson left. Marin watched him go and then turned back to the files. Her hands were steady, her breathing was even, but her mind was operating at a speed it hadn't reached in 2 years, processing tactical variables, anticipating countermoves, mapping the terrain of a conflict that was no longer medical, but operational. Rennick was fighting back. Not with evidence. He didn't have evidence. He was fighting with procedure, with legal maneuver, with the bureaucratic equivalent of suppressive fire. Not aimed at winning, but at buying time. She had seen this before. Not in hospitals. In theater. The scramble of a compromised position. The desperate bid to destroy evidence before the perimeter closed. Different context. Same architecture. She picked up the next file and kept working. At 4:15, Pearson returned. His expression was wrong. Not alarmed. Controlled, the way his expression became controlled when something had gone sideways, and he was processing the implications before choosing words. We have a problem, he said. Reyes looked up. What kind? Rennick's not in the building. He left through a service exit approximately 40 minutes ago. His car's gone from the parking lot, His attorney says he went home to rest and will be available for further interviews tomorrow. His system credentials? Kemper's IT director revoked them 20 minutes ago. But 20 minutes ago is not 40 minutes ago. Reyes closed her eyes. When she opened them, her expression had shifted from investigator to prosecutor. A subtle but unmistakable change that meant the stakes had just escalated from career consequences to potential criminal charges. "Check the access logs," she said. "Right now. Every record he accessed in the last hour." The answer came back in 11 minutes, delivered by a hospital IT specialist who looked like he wished he had called in sick that morning. Dr. Rennick accessed the medical record system at 15:28 using a workstation in the physician's lounge. He was logged in for 19 minutes. During that time, he accessed 34 patient records from cases dated between 24 and 36 months ago, outside the current audit window. The access logs show he opened each record, but we can't determine from the logs alone whether any modifications were made. We'd need to compare current records against backup snapshots to identify changes. "Do you have backup snapshots for records that old?" Reyes asked. "We have daily backups going back 12 months and weekly backups going back 24 months. Anything older than 24 months," he hesitated. "Our backup retention policy only covers 24 months. So for records between 24 and 36 months, you have no comparison baseline." "That's correct." The silence in the room had the quality of concrete setting, hard, final, and immovable. Rennick had gotten to the older records. Maybe he'd altered them. Maybe he'd just looked. But the absence of backup data meant that for an entire year's worth of surgical cases, the investigation might never be able to prove what the original records said. Marin sat with her hands flat on the table and felt the particular fury that comes from watching someone do the wrong thing and knowing they might get away with part of it. Not all of it. The last 18 months were documented, backed up, and locked down. But the 12 months before that were a shadow zone, and Rennick had walked into it and done whatever he'd done while the people trying to stop him were 20 minutes too slow. "There might be another way," she said. Reyes looked at her. "The nursing documentation that was deleted from the most recent cases, I found ghosts, lab orders, imaging orders, pharmacy records that pointed to assessments that should exist but don't. Those ancillary systems have their own retention policies. If radiology and pathology and pharmacy keep records longer than 24 months, we can use the same approach for the older cases. Map the ancillary data against the surgical records and identify gaps where documentation should exist but was removed." "How long would that take?" "For 34 cases? If I have access to the ancillary systems and someone from IT to pull the data, 3 days, maybe 4. You'd be rebuilding deleted records from circumstantial evidence. I'd be proving that records were deleted. The content of those records can be established through patient interviews, staff testimony, and clinical inference. If a patient had a lab draw at 0600 and a corresponding nursing note was deleted, we may not be able to prove exactly what the note said, but we can prove it existed and was removed. That's enough for a falsification charge." Reyes looked at Pearson. Pearson looked at Marin. The communication that passed between the three of them was wordless and immediate. The kind of alignment that happens between people who think in systems and act on evidence. "Start tonight," Reyes said. "I'll need access to radiology, pathology, and pharmacy record systems, and someone who knows the hospital's data architecture well enough to pull records by date and patient ID. I'll get you both." Marin turned back to the files. The sun was going down outside the conference room window, turning the Montana sky the color of bruised copper, and the fluorescent lights inside the room seemed suddenly brighter and colder by comparison. She had been in this building for almost 12 hours. Her back ached. Her eyes were dry. She hadn't eaten since the bowl of cereal in her apartment 22 hours ago, and her blood sugar was low enough that the edges of her vision were starting to soften in ways she recognized. She ignored all of it. She had worked through worse, much worse. At 6:30, the IT specialist returned with access credentials for the ancillary systems, and Marin began the painstaking process of cross-referencing radiology orders against surgical records for the 34 cases Rennick had accessed that afternoon. By 8 o'clock, she had found discrepancies in 9 of them. By 9:30, she had found discrepancies in 14. By 11, she had a preliminary map of deletions that spanned 26 months and touched 41 patients. Reyes, who had stayed through the evening reviewing Marin's findings in real time, set down her pen at 11:15, and said something that Marin would remember for a long time. "You know what you've built here." Marin looked up from the screen. Her eyes were red. Her hands had finally started to tremble, not from emotion but from low blood sugar and caffeine deficit, and the particular exhaustion that comes from sustained high cognition work performed on an empty stomach. "A case," she said. "More than that. You've built a methodology, a way to detect record falsification that doesn't depend on having the original records. If this holds up, if the ancillary data mapping proves reliable as an evidentiary standard, it changes how these investigations are conducted nationally." She paused. "That's not a small thing." "It's not a thing at all until it survives cross-examination," Marin said, and the pragmatism in her voice was so complete that Reyes almost smiled. "Go home," Reyes said. "Eat something. Sleep. Tomorrow we present the preliminary findings to the U.S. Attorney's Office, and I need you functional, not collapsed." Marin saved her work, logged out of the system, and stood. Her legs protested. Her vision swam for half a second, the blood sugar, and she steadied herself on the edge of the table without anyone noticing. She walked through the empty hospital corridors toward the main exit. The building was quiet now, running on night shift autopilot, the halls lit by reduced lighting that turned everything the color of old photographs. She passed Sandra Oakes's recovery bay on the way out. Sandra was asleep. Her monitors showed steady vitals. She was going to live. Marin stepped outside into the cold. The parking lot was nearly empty. The military vehicles were still there, dark and silent. Her Subaru sat alone in the back row, its cracked windshield catching the light from a single parking lot lamp. She was 10 steps from her car when she saw it. A piece of paper, folded once, tucked under her windshield wiper. She pulled it out and unfolded it. The handwriting was small, precise, and furious. The handwriting of a person whose control had failed completely. 2 sentences. No signature. "You should have stayed invisible. You have no idea what you've started." Marin stood in the parking lot holding the note, and the cold Montana air pressed against her skin. And the military vehicles sat dark behind her. And somewhere in the town of Briarfield, a man who had spent 11 years hiding behind a white coat was sitting in the dark writing threats to a woman he still believed was just a nurse. She folded the note carefully, placed it in her pocket, and pulled out her phone. She dialed Pearson's number. He answered on the first ring, because colonels who run special operations commands don't sleep at 11:30 on a Tuesday night when an active investigation is in progress. "I just found a note on my car," she said. Her voice was flat, operational. The voice she used when the situation required action rather than reaction. She read him the 2 sentences. The silence on the other end lasted exactly 4 seconds. "Don't go inside your apartment," Pearson said. "Stay in your car. Lock the doors. I'm sending a team to your location right now." Marin looked up at the dark windows of her apartment above the hardware store. The lights were off, the way she'd left them that morning. The curtains were drawn. Nothing looked wrong, but nothing looking wrong and nothing being wrong were 2 very different things. And Marin Calloway, combat medic, trauma nurse, the woman who had saved a colonel's life with a field scalpel and her bare hands in a place the government wouldn't name, had survived this long because she knew the difference. She got in the car, locked the doors, and waited. The team arrived in 7 minutes. 2 soldiers in an unmarked SUV, moving with the quiet professionalism of people who had secured locations far more dangerous than a 1-bedroom apartment above a hardware store in rural Montana. They cleared her apartment in under 4 minutes. Every room, every closet, the narrow stairwell that led up from the street-level entrance beside the hardware store's loading dock. Nothing had been disturbed. Nothing was missing. No one had been inside. But the note was real, and Pearson treated it accordingly. By midnight, the note was sealed in an evidence bag and logged into the investigation's chain of custody. By 12:30, Commander Reyes had added a potential witness intimidation charge to the growing list of federal offenses under consideration. By 1 in the morning, Marin was sitting in a motel room 6 miles outside Briarfield, a precautionary relocation that Pearson had arranged with the kind of logistical speed that suggested he had contingency plans for contingency plans. Staring at a ceiling she didn't recognize, and eating a gas station sandwich that tasted like cardboard wrapped in regret. She slept for 4 hours. It was enough. At 6 a.m. Wednesday, she drove back to Elkhorn Valley and walked into the conference room where Reyes was already seated with a fresh legal pad and a laptop displaying a video conferencing interface. On the screen, split into 3 panels, were the faces of 2 attorneys from the U.S. Attorney's Office in Helena and a senior investigator from the Department of Defense Inspector General. Marin Calloway, Reyes said by way of introduction, clinical consultant to the investigation. She built the evidentiary framework I briefed you on last night. The senior attorney, a woman in her 50s with the particular brand of fatigue that came from managing federal caseloads in an understaffed district, looked at Marin through the screen with the appraising directness of someone who evaluated witnesses the way engineers evaluated load-bearing walls. Ms. Calloway, Commander Reyes tells me you've identified documentation discrepancies in 41 surgical cases spanning 26 months using a cross-referencing methodology based on ancillary medical records. Is that accurate? 43, Marin said. I found 2 more this morning before the call. And in how many of those 43 cases can you demonstrate that original nursing documentation was deleted from the electronic medical record? 31 with high confidence. The remaining 12 show patterns consistent with deletion, but the ancillary evidence is circumstantial rather than conclusive. High confidence meaning what specifically? Meaning the ancillary systems, lab orders, radiology requests, pharmacy dispensation records, contain entries that correspond to clinical assessments which should appear in the nursing documentation, but don't. The lab orders were placed by someone. The nursing notes that would explain why those labs were ordered have been removed. In 17 of the 31 cases, I can identify the specific timestamp window during which the deletions occurred, and those windows correlate with the same midnight to 3 a.m. access pattern that the original audit flagged. The attorney made a note. The IG investigator leaned forward slightly. Ms. Calloway, are you aware that the methodology you've described, using ancillary medical data to reconstruct evidence of deleted primary documentation, has not been used as an evidentiary standard in previous federal healthcare fraud prosecutions? I'm aware. How confident are you that it would survive a Daubert challenge? I'm a nurse, not an expert witness. But the logic is straightforward. If a physician orders a CBC at 0600, someone made a clinical assessment that warranted that order. If the nursing note documenting that assessment no longer exists in the record, either the note was never written, which would be a nursing practice violation that would have triggered separate compliance flags, or it was written and subsequently deleted. The absence of compliance flags for missing documentation, combined with the presence of lab orders that presuppose that documentation, creates an evidentiary inference that's hard to explain away. Boss? The attorney looked at the IG investigator. The IG investigator looked at Reyes, the kind of triangular glance that meant everyone in the conversation had just arrived at the same conclusion independently. We're moving forward with the criminal referral, the attorney said. I want a complete evidentiary package on my desk by Friday. Commander Reyes, coordinate with Ms. Calloway on the clinical annotations. I'll assign a forensic data analyst to validate the ancillary record methodology independently. The call ended. Reyes closed the laptop and looked at Marin. You just convinced a federal prosecutor to base a criminal case on a framework you invented in a supply closet 48 hours ago. I invented it at a conference table. The supply closet was a separate conversation. Reyes did something Marin hadn't seen her do before. She laughed. It was brief, controlled, and slightly startled. The laugh of a person who had forgotten that laughing was something she did. Then it was gone, replaced by the operational focus that was Reyes's default state. We need to talk about the note, Reyes said. The handwriting analysis won't be back for another day. But I want your assessment. Do you believe Rennick wrote it? Marin had thought about this during the 4 hours she'd spent not sleeping in the motel room. The handwriting was precise, controlled. Not the handwriting of someone in a rage. The handwriting of someone who wanted to deliver a message with maximum impact using minimum words. That's consistent with Rennick's personality. He's a performer. Even his threats would be curated. His attorney will argue anyone could have placed that note. His attorney can argue whatever he wants. The note was placed between 10:30 p.m., when I last saw my car through the conference room window, and 11:15 when I found it. During that window, the parking lot was monitored by 2 soldiers stationed near the communications truck. If Rennick or anyone acting on his behalf entered that lot, the soldiers may have seen them. I've already requested their statements. Reyes paused. There's something else. Rennick's attorney filed an emergency motion with the state medical board this morning at 7:45. He's not just challenging the privilege suspension anymore. He's alleging that the federal investigation has been compromised by the involvement of a material witness, you, who has a personal grievance against his client and whose participation as a consultant represents a conflict of interest. The words hung in the air like smoke. Marin processed them with the clinical detachment she applied to everything, examining each component, evaluating the threat level, measuring the distance between what was alleged and what was true. He's trying to disqualify me from the investigation, she said. He's trying to taint the investigation by associating it with your suspension. If he can establish that you were motivated by retaliation rather than professional obligation, he can challenge the credibility of every discrepancy you've identified. The discrepancies exist regardless of who identified them. The data doesn't change because of who reads it. You know that. I know that. A defense attorney in front of a jury will argue otherwise. Reyes leaned back, which is why the forensic data analyst the U.S. attorney is assigning will independently validate every finding. Your work becomes the roadmap. Someone else drives the car in court. Fine. I don't need credit. I need the 41 patients whose records were altered to get the truth. 43, Reyes corrected, and the correction carried something that felt almost like warmth. They spent the next 3 hours assembling the evidentiary package. Marin annotated each case with clinical context, what the documentation should have contained, what it actually contained, and what the gap between those two things meant for the patient's care. She wrote in the same precise, fact-driven language she had learned in a world where ambiguity costs lives, and Reyes read each annotation with the focus of someone building something that needed to survive hostile scrutiny. At 10:45, the building's seismic activity shifted again. Joan Kemper appeared in the conference room doorway, looking like a woman who had just received news that her house was on fire and was trying to decide whether to call the fire department or the insurance company first. "Colonel Pearson," she said, "I need to speak with you immediately." Pearson, who had been reviewing documents at the far end of the table, stood. "What's happened?" "Dr. Rennick just submitted his resignation, effective immediately. His attorney delivered it to my office 10 minutes ago, along with a non-disclosure agreement that he's requesting the hospital sign as a condition of his departure." The room reconfigured. Everyone stopped what they were doing. Marin set down her pen. "A non-disclosure agreement," Pearson repeated. His attorney is arguing that a quiet resignation serves the hospital's interests by avoiding prolonged public scrutiny and that the NDA would protect both parties from further reputational damage. Kemper's voice was steady, but her hands weren't. She was holding a manila envelope, and the envelope was trembling. "He's offering to surrender his medical license voluntarily in exchange for the hospital declining to cooperate further with the federal investigation." The temperature in the room dropped by several degrees. Not literally, the HVAC system was functioning normally, but psychologically, the shift was palpable. Rennick was trying to negotiate his exit. He was trying to trade his license for silence, to convert a criminal investigation into an administrative separation, to walk away from 2 years of falsified records and endangered patients with nothing more than the loss of a credential he could no longer use anyway. "Ms. Kemper," Reyes said, and her voice had the particular quality of a blade being drawn from a sheath, smooth, controlled, and unmistakably dangerous. "I need to be very clear about something. This is a federal criminal investigation. Dr. Rennick cannot negotiate his way out of federal charges by resigning from a hospital. His medical license is a state matter. The falsification of federally funded medical records is a federal matter. Those two things exist in separate legal universes. And if your hospital signs a non-disclosure agreement designed to obstruct a federal investigation, you will be adding obstruction charges to the list of institutional liabilities that are already accumulating." Kemper's face went through 3 distinct phases in approximately 2 seconds: alarm, comprehension, and the particular shade of administrative panic that occurs when a person realizes they are standing between 2 opposing forces and neither one intends to yield. "I have no intention of signing the NDA," she said. "I came here to inform you of the request, not to endorse it. Good. Because I need one more thing from you. I need the names and current contact information for every nursing and support staff member who was separated from this facility in the past 3 years following complaints about Dr. Rennick or his department. I gave you 7 names yesterday. Yesterday I asked for 18 months. Today I'm asking for 36. The number may be higher than 7. Kemper looked like she wanted to sit down. I'll have HR pull the records. By noon, Kemper left. Pearson walked to the window, his thinking position, Marin had noticed, and stood with his hands clasped behind his back. He's panicking, Pearson said. He's strategizing, Marin corrected. Panic looks different. This is a calculated retreat. He knows the criminal referral is coming, so he's trying to create separation between himself and the institution before the charges drop. If he resigns voluntarily and surrenders his license, his attorney can argue that he's already accepted consequences and that criminal prosecution is punitive rather than corrective. Will that work? Not with 43 falsified records and a threatening note in an evidence bag, but it might reduce his sentence from severe to moderate. And for a man like Rennick, the difference between 8 years and 3 years is the difference between his career ending and his life ending. He'll fight for every inch. Pearson turned from the window and looked at her. Really looked. Not with the operational assessment he usually employed, but with something closer to personal recognition. You think like a tactician. I was trained by tacticians. You were trained as a medic. Medics who operate with special forces learn to think like the people they're keeping alive. You adapt or you become a liability. I adapted. He held her gaze for a moment longer than necessary, and what passed between them was not rank or protocol or the formal structure of a military relationship. It was the wordless acknowledgement of 2 people who had survived the same fire and come out the other side carrying different scars but the same instincts. The HR records arrived at 11:53. The number wasn't 7, it was 12. 12 employees separated from Elkhorn Valley Medical Center over the past 3 years, all from surgical or surgical-adjacent departments, all following documented or informal complaints about practices in Dr. Theodore Rennick's division. 7 nurses. 2 surgical technicians, 1 pharmacy tech, 1 radiologic technologist, 1 compliance analyst. Marin read the names. She recognized 4 of them, people she had worked alongside, people who had been there when she started and then weren't, their absences explained by the usual institutional euphemisms. Moved on to other opportunities, personal reasons, restructuring. She had accepted those explanations because accepting them was easier than questioning them. And questioning them meant becoming the next name on the list. The 12th name made her stop reading. Garrett Pryor, the compliance director, the man who had sat in the same conference room yesterday and told Reyes he had noted his concerns about documentation practices and moved on to other compliance priorities. Pryor wasn't on the list as a separated employee. He was on the list as a complainant, an internal memo from 27 months ago, buried in an HR file, documenting Pryor's formal written concern about surgical outcome reporting irregularities. The memo had been addressed to Joan Kemper. Attached to the memo was a response from Kemper's office, dated 1 week later, directing Pryor to defer to the clinical department's assessment of data accuracy and to focus compliance resources on areas with greater regulatory exposure. Kemper had known, not suspected, not overlooked, known. She had received a written complaint from her own compliance director and had instructed him to stand down. Marin set the document on the table. Reyes read it. Pearson read it over her shoulder. Nobody spoke for 10 seconds. She lied to us, Reyes said. Her voice was flat. Not angry, not surprised, just flat. The way a surface becomes flat when everything on it has been swept away. She sat in this room yesterday and said she was not aware of systematic record alteration. She had a written complaint in her files. She'll argue the complaint was about reporting irregularities, not falsification. There's semantic daylight between those terms. There's no daylight between receiving a written complaint and instructing your compliance officer to ignore it. That's administrative complicity. Reyes stood. I need to make a call. She left the room. Pearson remained at the window. Marin remained at the table, surrounded by files and laptops and the accumulated evidence of a system that had failed not because it lacked safeguards, but because the people responsible for those safeguards had chosen, one by one, to look away. An hour later, the U.S. Attorney's Office in Helena issued a formal notification to Elkhorn Valley Medical Center that the federal investigation had expanded to include potential administrative complicity in the falsification of federally funded medical records. Joan Kemper was named as a person of interest. Boyd Worthen was named as a person of interest. Garrett Pryor was offered a cooperation agreement in exchange for full testimony regarding the institutional suppression of his compliance concerns. Pryor accepted within 90 minutes. When he sat down in the conference room for his second interview, he looked like a different person than the man who had hedged and qualified his way through the first one. The defensiveness was gone. In its place was the hollow-eyed relief of someone who had been carrying a secret for 27 months and had finally been given permission to set it down. "I wrote that memo because I believed the data was being manipulated," he said. "When Kemper told me to stand down, I understood what she was telling me, not the words, the meaning. She was telling me that the hospital's federal funding was more important than the accuracy of the data that justified it. And he stopped, swallowed. I complied. I shouldn't have. I knew it was wrong, and I complied because I had 6 years invested in this position, and I convinced myself that someone else would eventually catch it." "Someone did," Marin said from across the table. Pryor looked at her. His eyes were wet, but his voice was steady when he spoke. "I know. And it should have been me." The afternoon dissolved into a cascade of legal motions, institutional communications, and the particular kind of organized chaos that accompanies the collapse of a power structure that has been held together by silence. Kemper was informed of her designation as a person of interest at 2:15. She retained legal counsel by 2:45. Worthen, who had been hovering at the edges of the investigation like a man trying to determine which direction to jump, received the same notification at 2:30 and immediately began cooperating, providing a detailed account of every directive he had received from Kemper regarding personnel actions, media inquiries, and complaint handling. Rennick's resignation was formally rejected by the hospital board at 3 o'clock, on the grounds that accepting a resignation during an active federal investigation could be construed as facilitating the subject's separation from institutional accountability. His attorney filed a protest. The protest was noted and filed. At 4:20, the Montana State Medical Board issued a preliminary response to Rennick's emergency motion, declining to intervene in the federal investigation's recommendation regarding clinical privileges and noting that the board would conduct its own independent review of Dr. Rennick's medical license based on the evidence provided by federal investigators. At 5 o'clock, Marin finished the last of the 43 case annotations. She stacked the files, organized the clinical summaries, and handed the complete package to Reyes. "It's done," she said. Reyes took the stack. She held it for a moment, measuring the weight perhaps, or the meaning. 43 patients, 43 altered records, 43 truths that had been buried by a man who believed his authority made him untouchable, and by an institution that had chosen convenience over accountability. "Marin," Reyes said, "when this goes to prosecution, the 43 patients will be notified about the alterations to their records. Some of them may have experienced adverse outcomes that were misattributed or concealed. Some may choose to pursue civil litigation. All of them deserve to know what happened." "I know. The notification process is going to be difficult for the patients and for the staff who cared for them. You understand that?" "I understand that the truth is difficult. I also understand that the alternative is worse." Reyes nodded. She placed the stack in her document case with the care of someone handling something that mattered. Marin stood up from the conference table for the last time that day. Her body ached in places she hadn't known she still had. The lower back, the shoulders, the small muscles behind her eyes that protested after 18 hours of reading medical records under fluorescent light. She was running on coffee and determination and the particular kind of endurance that came from having once worked 97 consecutive minutes keeping a man alive with her hands inside his chest cavity. Everything since then was calibration. She walked toward the exit. The hallway was quiet. Evening shift had started and the day staff had gone home, carrying with them the fragmented, half-understood versions of the story that would dominate Briarfield's conversations for weeks. She was passing the nursing station when Donna intercepted her. "Sandra Oaks is being moved to a regular room tomorrow. She asked me to tell you something." "What?" She said, "Tell the nurse who kept coming back that she's the reason I'm still here." And then she asked for your name, and when I told her, she asked me to write it down because she didn't want to forget it." Marin stood in the hallway and absorbed that. She didn't cry. She hadn't cried in longer than she could accurately remember. But something shifted behind her sternum, a loosening she hadn't anticipated, as if a knot she'd been carrying had slipped by 1 degree. "Thank you," she said. She drove to the motel. She ate a real meal, a burger from the diner across the road, medium rare, with fries that were oversalted in the way that only small-town diners could get away with. She sat on the motel bed and looked at Pearson's business card, which was still in her pocket, slightly bent now from 3 days of being carried. She set it on the nightstand beside the lamp. Then her phone rang. Not the reporter. Not Donna. The caller ID displayed a number with a Washington, D.C. area code. She answered. "Miss Calloway, this is Senator Margaret Holcroft's office. The senator chairs the Armed Services Subcommittee on Personnel and has become aware of the situation at Elkhorn Valley Medical Center through a briefing from the Department of Defense Inspector General. The senator would like to invite you to provide testimony before the subcommittee regarding systemic vulnerabilities in federally funded medical oversight at civilian facilities serving veteran populations." Marin sat on the motel bed with the phone against her ear and the business card on the nightstand and the taste of oversalted fries still on her tongue, and she felt the last wall of the small, invisible life she had built crack open, not violently, not destructively, but inevitably, the way ice cracks in spring when the temperature rises past the point where frozen things can stay frozen. A Senate subcommittee. Testimony. Washington. The opposite of everything she had chosen for the past 2 years, and the logical conclusion of everything she had done in the past 3 days. She looked at the card on the nightstand. She looked at the phone in her hand. And somewhere in Briarfield, Montana, in a house she had never visited, Theodore Rennick sat in the dark with a lawyer who was running out of strategies and a medical license that was beginning to exist only on paper, while the nurse he had called disposable was being asked to speak to the United States Senate about the system he had spent 11 years corrupting. "Tell the senator," Marin said, "that I'll need to check my schedule." She hung up and stared at the ceiling for a very long time, and the ceiling stared back, and neither of them blinked. She didn't sleep that night either, but the insomnia was different this time. Not the operational hypervigilance of a mind scanning for threats, but the restless wakefulness of a person standing at a fork in a road she hadn't known existed until 72 hours ago. The motel ceiling offered no counsel. The business card on the nightstand offered too much. The phone, silent now on the bedspread beside her, held a Washington area code in its recent calls list that felt less like a phone number and more like a door she hadn't decided whether to open. At 4 a.m., she got up, made coffee with the motel room's single-serve machine that produced a liquid more accurately described as hot brown water, and sat in the chair by the window watching the parking lot lighten by degrees as the Montana sky shifted from black to charcoal to the pale, bruised gray that preceded sunrise in the mountains. She drank the terrible coffee. She thought about Sandra Oaks writing her name on a piece of paper so she wouldn't forget it. She thought about the 12 employees who had been pushed out of Elkhorn Valley, scattered across the state like seeds from a dying tree, their careers interrupted or ended because they had done the thing you're supposed to do when something is wrong. They had spoken. She thought about Monica Vasquez, the surgical resident exiled to a critical access hospital in Sheridan, Wyoming, for the crime of telling the truth about documentation practices. Marin had never met her. She didn't need to. She knew her the way veterans know each other without introductions, by the shape of what they'd survived. At 5:15, she picked up the phone and called Pearson. "I'll testify," she said. "Senate subcommittee, whatever they need." "You sure?" "No, but I'm doing it anyway." That's usually how the important decisions work. She showered, dressed in the only clean clothes she had left, jeans and a flannel shirt that smelled like motel detergent, and drove back to the hospital for what she suspected would be the last time she entered Elkhorn Valley Medical Center as an employee. Something about the decision to testify had shifted the ground beneath that role. She could still be a nurse. She could still be a nurse at this hospital, technically. But the version of herself that had chosen this place because it was small and quiet and invisible had been replaced by someone who had stood in a conference room annotating 43 cases of medical fraud for a federal investigation, and that person didn't fit in the same container anymore. The hospital parking lot was different this morning. The military vehicles were gone, relocated overnight, according to a text from Pearson, to the National Guard Armory in Billings, where the investigation would continue with full forensic support. Their absence left the lot looking oddly naked, like a stage after the set has been struck. 2 news vans had taken their place, parked near the main entrance with satellite dishes raised and reporters standing in the early light, rehearsing segments into cameras that weren't yet live. Marin entered through the employee entrance on the east side of the building. She didn't want to be on camera, and she didn't want to explain to a reporter with a microphone why a nurse in a flannel shirt was walking into a hospital that was currently the subject of a federal investigation. She badged in, walked through the service corridor, and arrived at the emergency department at 6:10. Donna was already there. She looked like she'd slept slightly better than the night before, which was still not well enough, and she was holding 2 cups of coffee from the break room. "I figured you'd come early," she said, handing Marin a cup. "Thank you." The board met last night, emergency session. They've appointed an interim chief of surgery, Dr. Paulson from the orthopedic department. He's temporary until they complete a national search. Paulson's solid. Paulson's terrified. He spent 20 minutes this morning asking me how the nursing documentation system works because he's never had to think about it before. Apparently, not all surgeons ignore nursing notes. Apparently, they stood in the hallway drinking bad coffee and not saying the things that were too large for a hospital corridor at 6 in the morning. Then Donna said, "I heard about the Senate thing." "How?" "Pearson told the nursing director, who told Marcus, who told me. This building has the information security of a screen door." Marin almost smiled. "I haven't officially accepted yet." "But you're going to." "Yeah, I'm going to." Donna looked at her for a long moment, the kind of look that carries 19 years of nursing and 3 kids and a mortgage and the accumulated weight of every compromise a person makes to keep their life functional. "You know what I keep thinking about? Those 7 names, the 12 names. However many it ends up being. The people who said something and got pushed out. I knew some of them. Linda Hartwell. She was an ICU nurse here for 8 years. Best IV start I ever saw. She complained about a post-op note that didn't match what she'd documented, and 6 weeks later she was gone. HR called it a performance-related separation. I went to her going-away lunch. I brought a card." Donna's voice tightened. "I brought a card to the going-away lunch of a woman who was fired for telling the truth, and I didn't say a single thing about why she was actually leaving. Not one word." "Donna, I'm not looking for absolution. I'm telling you because I want you to understand what that testimony means. It's not just about Rennick. It's not just about the records. It's about every person in every hospital who sees something wrong and stays quiet because the cost of speaking is higher than the cost of silence. If you go to Washington and you say what you know, you're saying it for all of them. For Linda, for Monica Vasquez, for the pharmacy tech whose name I can't even remember because she was here for less than a year before they ran her out." Marin held her coffee cup with both hands and felt the heat through the ceramic and let Donna's words settle into the space they deserved. She didn't respond immediately because the response that mattered wasn't verbal. It was the decision she had already made. The phone call at 5:15, the commitment to walk into a room full of senators and cameras and say the things that 12 people before her had tried to say in smaller rooms to people who chose not to listen. "His name was Derek Wojcik," Marin said. "What?" "The pharmacy tech. His name was Derek Wojcik. He was here for 11 months. He flagged a discrepancy in post-operative medication reconciliation records, and Rennick's office recommended his termination for failure to adhere to departmental communication protocols. I remember because he trained me on the medication dispensing system when I started." Donna's eyes filled. This time the tears did fall. She wiped them with the back of her hand and took a breath that shuddered on the way in. "Damn it, Calloway." "Yeah." They went to work. The morning passed in the strange dual reality that had defined the past 3 days. The ordinary machinery of emergency medicine running alongside the extraordinary machinery of institutional collapse. Patients arrived, were triaged, treated, and discharged or admitted. The work was the same. The building was not. Staff members spoke in lower voices. Administrators moved through hallways with the cautious gait of people walking on surfaces they no longer trusted. The news vans outside multiplied, 3 by 9 a.m., 5 by noon, and the hospital's communications office, which consisted of one overwhelmed woman named Terry, who had been hired to write newsletter copy and manage the hospital's barely active social media accounts, was fielding 30 calls an hour from media outlets across the country. At 10:30, the U.S. Attorney's Office in Helena announced a federal grand jury investigation into medical record falsification at Elkhorn Valley Medical Center. The announcement named Dr. Theodore Rennick as the primary subject and identified additional persons of interest within the facility's administrative leadership. It did not name Joan Kemper or Boyd Worthen specifically, but in a town of 14,000 people, specificity was redundant. At 11:15, the Montana State Medical Board issued an emergency suspension of Dr. Theodore Rennick's medical license, effective immediately, pending completion of the board's independent review. The suspension was published on the board's public website, which meant that every hospital, clinic, and medical facility in the state, and every credentialing database in the country would see it within 24 hours. Rennick's ability to practice medicine anywhere in the United States had been functionally terminated. At 12:40, Rennick's attorney issued a public statement on his client's behalf. Marin read it on Donna's phone during a break she wasn't really taking. The statement was 3 paragraphs of carefully constructed language that managed to simultaneously deny wrongdoing, express deep concern for any patients who may have been affected by documentation irregularities, and suggest that the federal investigation had been influenced by personal animus on the part of individuals with unresolved grievances against Dr. Rennick. It did not name Marin. It didn't need to. She read it twice, set the phone down, and went back to a patient with a dislocated shoulder who needed reduction and was far more interesting than a disgraced surgeon's press release. At 2 o'clock, Commander Reyes called from Billings. The grand jury has issued subpoenas for hospital electronic medical records going back 48 months. Rennick's attorney has filed a motion to quash. It won't succeed, but it'll add 72 hours to the timeline. More importantly, the handwriting analysis on the note left on your car came back. And? Inconclusive for Rennick specifically, but the analyst identified characteristics consistent with a right-handed male writer under significant psychological stress. We've requested a formal exemplar from Rennick through his attorney. His attorney has, predictably, refused. So it dead ends. For now. But witness intimidation is a separate charge that doesn't require the note to be prosecuted. The act of placing a threatening communication on a federal consultant's vehicle during an active investigation is sufficient, and the parking lot security footage from the motel across the street, which we obtained this morning, shows a vehicle matching the description of Rennick's registered sedan entering the hospital parking lot at 10:47 p.m. on the night in question. Marin processed that. You have him on camera. We have a vehicle on camera. His attorney will argue someone else was driving. We're working on enhancing the footage. Reyes paused. Marin, the practical impact of this is that the intimidation charge strengthens the overall case by demonstrating consciousness of guilt. A man who leaves threatening notes on a witness's car is not a man who believes the investigation will exonerate him. I already knew that. I know. But I wanted you to hear it from someone who can say it in a courtroom. They hung up. Marin finished her shift at 3:30, charted her last patient, and sat at the nursing station for a few minutes doing nothing, which was unusual for her, and Donna noticed, and Marcus noticed, and neither of them said anything because they understood that doing nothing was sometimes the hardest thing a person who had been doing everything could do. At 4 o'clock, she went to see Sandra Oakes. Sandra had been moved to a regular room on the second floor, room 214, a window bed with a view of the parking lot and the mountains beyond it. She was sitting up, which was a significant improvement, and she was eating Jell-O with the careful deliberation of someone whose abdomen had recently been opened and closed and who understood that the digestive tract had opinions about rushing. "Hi," Marin said from the doorway. Sandra looked up. Her face changed, not dramatically, not with the kind of cinematic recognition that happens in stories, but with the small, real shift that happens when a person sees someone who matters. "Come in," she said. "I've been waiting." Marin entered and sat in the visitor's chair. The room smelled like hospital food and antiseptic and the particular staleness of recycled air that had been passed through the same filters too many times. "How's the pain?" Marin asked. "Manageable." The surgeon, the new one, not the other one, he came by this morning and said the repair looks clean. No infection. Drain comes out tomorrow, maybe? "That's good." "Marin." Sandra set down her Jell-O spoon. I heard things. From the nurses. From other patients. From the news on my phone, I heard what that doctor did. The records. The other patients. All of it. She paused. And I heard what he did to you. The suspension. Walking you out in front of everyone because you tried to help me. I was doing my job. Your job didn't require you to come check on me at 6 in the morning when you weren't even on shift. Your job didn't require you to fight for me when nobody else was listening. You did that. Sandra's voice cracked. She wasn't a crier. Marin could tell that about her, the way you can tell some things about people by the effort they put into controlling their faces. But the crack was there, and it was real. I almost died because a doctor ignored a nurse. And I'm alive because that nurse wouldn't stop trying. Marin sat in the visitor's chair and let the words land. She didn't deflect them or minimize them or redirect them into something more comfortable. She let them be what they were. The testimony of a patient whose life had been treated as less important than a surgeon's ego, delivered directly to the person who had refused to accept that equation. You're going to be okay, Marin said, physically and otherwise. I know, but I want you to know something. When they told me about the federal investigation and the records and all of it, they sent a woman, a lawyer, very formal. She explained what had happened to my surgical documentation. She said the operative report had been altered to blame my delayed surgery on nursing communication failure. She said you had documented the problem twice, correctly, and that the documentation had been changed to protect the surgeon. Sandra stopped, drew a breath. Do you know what that feels like? To find out that the person who saved you was blamed for failing you? I can imagine. No, you can't, because you're on the other side of it. But I want you to know, I told that lawyer everything. I gave a statement. I told her that you were in my room at 6 in the morning with your hand on my IV line when nobody else had come for 20 minutes. I told her you were the one who noticed my blood pressure dropping. And I asked her to make sure that when this goes to court, the record shows what actually happened, not the version someone typed at midnight to cover their own mistake. Marin nodded. She didn't trust her voice for a moment, so she waited until she did. Thank you, Sandra. Don't thank me. I'm just telling the truth. Apparently that's been in short supply around here. Marin left Sandra's room and walked to the stairwell, because the stairwell was the one place in a hospital where you could be alone for 30 seconds without someone paging you or asking you a question. She stood on the landing between the second and third floors and pressed her hands flat against the cold concrete wall and breathed 4 counts in, 4 counts hold, 4 counts out. The way she'd been taught a long time ago in a place designed to break people and rebuild them into something harder. She wasn't harder. That was the thing people misunderstood about what the military had done to her. It hadn't made her harder. It had made her clearer. It had stripped away the insulation that most people carried between themselves and the truth, and it had left her with an uncomfortable, persistent ability to see things as they were, rather than as she wished they were. That ability had made her an extraordinary medic. It had made her a good nurse. It had made her a difficult person to be close to, because people who see clearly are people who can't pretend. And pretending is the lubricant that keeps most human relationships from grinding to a halt. She took one more breath, then she went back to work. The days that followed compressed the way time compresses when events acquire their own momentum. Thursday. The forensic audit expanded to cover 4 full years of surgical records. Friday. The grand jury received its first round of evidence. The following Monday, the U.S. Attorney filed a 17-count federal indictment against Theodore Rennick, charging him with falsification of federal medical records, healthcare fraud, obstruction of a federal investigation, and witness intimidation. The indictment was unsealed on Tuesday and published in full on the Department of Justice website, where it was downloaded 40,000 times in the first 12 hours. The witness intimidation charge was based on the parking lot security footage, which, when enhanced, showed not only Rennick's sedan but Rennick himself, visible through the driver's side window, parked near Marin's Subaru for approximately 3 minutes on the night in question. His attorney's argument that someone else had been driving collapsed along with whatever remained of Rennick's defense strategy. Joan Kemper resigned on Wednesday, 3 hours before the U.S. Attorney's Office notified her that she would be named in a separate indictment for administrative obstruction, specifically for directing her compliance director to suppress documented concerns about record falsification, and for approving the retaliatory separation of employees who raised those concerns. Boyd Worthen, whose cooperation had been thorough, if not exactly voluntary, was offered a deferred prosecution agreement in exchange for his testimony. He accepted. The Elkhorn Valley Medical Center Board of Trustees held a public meeting on Thursday evening. The meeting was attended by 340 people, roughly 2.5% of Briarfield's entire population, and lasted 4 hours. The board announced a comprehensive restructuring of the hospital's governance, compliance, and clinical oversight systems. They announced the creation of an independent patient safety review board with binding authority over documentation practices. They announced a formal review of all personnel actions taken against employees who had raised concerns about surgical documentation. And they announced that the 12 employees who had been separated from the hospital in connection with complaints about Rennick's department would be contacted individually, offered formal apologies, and provided with the opportunity to return to their positions or receive compensation for lost wages and career disruption. Linda Hartwell, the ICU nurse, was in the audience. When the announcement was read, she stood up. She didn't say anything. She just stood, and the people around her, some of whom had worked alongside her, some of whom had attended her going-away lunch and brought cards and said nothing about the real reason she was leaving, turned to look at her, and the silence in the room was the silence of recognition, of seeing someone who had been made invisible and acknowledging that the invisibility had been a choice. Not hers, but theirs. Monica Vasquez was not in the audience. She was in Sheridan, Wyoming, 400 miles away, performing an emergency appendectomy on a rancher's 16-year-old daughter in a hospital with 32 beds and a surgical suite that hadn't been updated since 2011. But she received a phone call from the board that evening and another from Colonel Pearson the following morning, and a third from the residency program director at a major academic medical center in Denver, who had been made aware of her situation through channels that Pearson declined to specify. Vasquez would return to complete her surgical fellowship the following spring. She would graduate at the top of her cohort. She would never work at Elkhorn Valley, and she would never need to. The Senate subcommittee hearing took place 3 weeks later in a wood-paneled room in the Hart Senate Office Building in Washington, D.C. Marin flew commercial, wore a Navy suit that Donna had helped her pick out over a video call that devolved into 20 minutes of arguing about whether the jacket was too long, and sat at a witness table facing a semicircle of senators who represented, collectively, the federal government's authority over military health care policy. She was nervous, not in the way she'd been nervous in combat. That was chemical, adrenaline-driven, a physiological response to physical threat. This was different. This was the nervousness of a person who had spent 2 years hiding and was about to speak into a microphone connected to C-SPAN cameras that would broadcast her face and her voice and her story to anyone who cared to watch. Senator Holcroft, who chaired the subcommittee and who had the bearing of someone who had been asking difficult questions in this room for longer than Marin had been alive, looked at her with steady gray eyes and said, "Ms. Calloway, please state your name and professional qualifications for the record." Marin Calloway, registered nurse, former United States Army combat medic, specialist rank, attached to special operations units in operational theaters. I'm not authorized to identify in an open hearing. A murmur moved through the room. Holcroft waited for it to subside. Ms. Calloway, you are here today to provide testimony regarding systemic vulnerabilities in federally funded medical oversight at civilian facilities serving veteran populations. Before we begin, I want to acknowledge that you are testifying voluntarily, that you have waived the option to provide closed testimony, and that your willingness to speak publicly is noted and appreciated by this committee. Thank you, Senator. Please tell us what happened at Elkhorn Valley Medical Center. Marin looked at the microphone. She looked at the senators. She looked at the gallery behind them, where Pearson sat in the second row wearing a dress uniform she hadn't seen since the day he'd walked into the hospital lobby, and Donna Pelfrey sat beside him in a blazer she'd probably bought for the trip, her hands folded tightly in her lap, and 3 of the 12 former Elkhorn Valley employees sat scattered through the rows. Linda Hartwell, Derek Wojcik, and a surgical technician named Rose Amaro, whose name Marin had learned only 2 weeks ago when the full list had been compiled. She took a breath, and she told them. She told them about the bus accident and the trauma cases and the ventilator adjustment that was clinically correct and professionally punished. She told them about Sandra Oaks and the 2 documented escalations, and the surgeon who ignored them and then blamed her for the delay. She told them about the suspension, the security guards, The walk through the lobby, in blood-stained scrubs past patients and colleagues who watched in silence. She told them about the altered records, the deleted nursing notes, the midnight modifications, the statistical impossibilities that had passed through a compliance system designed to catch exactly this kind of fraud and had been waved through by people who had been told to look the other way. She told them about the 12 employees. She said their names, every one of them, into the microphone, and the names entered the congressional record, and the record became permanent, which meant that the erasure those people had experienced was itself being erased, replaced by official acknowledgement in a building where acknowledgement carried the weight of law. She did not tell them about the classified mission. She did not tell them about Pearson's chest cavity or the 97 minutes or the commendation she had refused. Those things lived in sealed files and in the memories of people who had been there, and she saw no reason to perform them for cameras. When she finished, Holcroft asked a question that Marin hadn't prepared for. Ms. Calloway, in your assessment, what allowed this situation to persist for as long as it did? Not the technical failures. We'll address those with the Inspector General. I'm asking about the human element. What made it possible for one physician to falsify records, retaliate against whistleblowers, and endanger patients for years without consequence? Marin sat with the question for a moment. She owed it that. Hierarchy, she said. Not the organizational kind, the psychological kind. The assumption that authority equals correctness. That the person with the highest title in the room is the person most likely to be right. In medicine, that assumption can be lethal because the person closest to the patient is usually the nurse, and the nurse is usually the lowest-ranking person in the clinical hierarchy. When a surgeon says one thing and a nurse says another, the system defaults to the surgeon, not because the surgeon's assessment is better, but because the system was built to protect authority rather than accuracy. She paused. Every person who was pushed out of Elkhorn Valley was pushed out because they contradicted someone with more authority. Not because they were wrong. They were right, every single one of them. And being right didn't protect them because the system wasn't designed to reward accuracy. It was designed to reward compliance. The room was quiet. Holcroft wrote something on her notepad. Two other senators leaned back in their chairs with the expressions of people who had just heard something they would repeat in policy discussions for years. Thank you, Ms. Calloway, Holcroft said. Your testimony will be incorporated into the subcommittee's recommendations for reform of federal medical oversight standards. Marin left the witness table on legs that felt like they belonged to someone else and walked out of the hearing room into the marble hallway of the Hart Building, where the light was cold and bright and the air tasted like stone and history and the particular institutional cleanliness of buildings where important things happen to people who don't always feel important. Pearson was waiting in the hallway. Well done, he said. I feel like I'm going to throw up. That's normal. It passes. When? Usually around the second or third time you testify. I'm not doing this again. You say that now. They walked outside into the November air of Washington, D.C. Sharp, bright, carrying the smell of fallen leaves and diesel exhaust and the distant sound of traffic on Constitution Avenue. Donna was on the steps of the building, talking on her phone with one hand and gesturing with the other in the way she did when she was simultaneously managing a conversation and processing an emotion she hadn't finished having. She hung up when she saw Marin. That was Marcus. He says hi. He also says the new chief of surgery is still asking how the nursing documentation system works, and Donna says she's going to make him a laminated cheat sheet. Marin laughed. It came out unexpectedly, like a cough. And it was not graceful or controlled or the kind of laugh that sounds good in a movie. It was the laugh of a person who had been holding herself in a specific shape for a very long time and had just felt one of the edges soften. What now? Donna asked. Marin reached into her jacket pocket and pulled out two things. Pearson's business card, now creased and worn from weeks of being carried, and the sealed envelope from the military briefcase, the commendation she had refused, which Pearson had placed in the administrative office at Elkhorn Valley, as promised, and which Marin had retrieved on her last day before flying to Washington. She looked at the card. She looked at the envelope. She looked at Pearson, who was watching her with the particular patience of a man who had waited 2 years to find her and was prepared to wait as long as necessary for whatever came next. The position you described, she said, medical oversight, civilian, DoD affiliated, reviewing facilities, training staff, building systems. Still available? I want to modify the scope. How? I want it to include a whistleblower protection component, a direct channel for clinical staff, nurses, techs, residents, anyone below the physician level, to report documentation concerns without going through institutional chains that can be corrupted. An independent reporting pathway that bypasses hospital administration entirely. Pearson looked at her the way commanding officers look at subordinates who have just proposed something that will generate enormous bureaucratic resistance and is also obviously correct. That's going to require interagency coordination, congressional authorization, and approximately 18 months of policy development, he said. I know. And you want to lead it. I want to build it. Leading it can be someone else's job. I'm better at the building part. He extended his hand. She shook it. The handshake was firm and brief and carried the weight of everything that had passed between them. A field thoracotomy in a place without a name, 2 years of searching, a salute in a hospital lobby, and the understanding that some debts are not repaid but redirected. Marin opened the sealed envelope. Inside were 3 commendation certificates, a unit citation, and a letter from a commanding general she had never met, recognizing her actions during the classified mission that had defined one version of her life and that she had spent 2 years pretending hadn't defined all of them. She read the letter once, folded it, and put it back in the envelope. I'm keeping these, she said, not because I need them, because the people I served with need me to stop pretending it didn't happen. Pearson nodded, that was all. Donna drove them to the airport because Donna had rented a car and Marin had not, and the drive through D.C. traffic took 45 minutes, during which Donna talked continuously about the hearing, the senators, the marble hallways, the look on Linda Hartwell's face when Marin had said her name into the microphone. Marin listened and said very little and watched the city pass through the car windows, the monuments, the buildings, the geometry of a capital designed to make individuals feel small against the scale of institutions. Which was ironic because the whole point of the past 3 weeks had been proving that individuals were the only thing that made institutions function or fail. At the airport gate, waiting for boarding, Donna said, "So you're really taking the DOD position?" "I'm really taking it." "Which means you're leaving Elkhorn Valley." "Which means I'm leaving Elkhorn Valley." Donna was quiet for a moment. The boarding area was crowded with travelers doing the things travelers do, checking phones, eating overpriced sandwiches, pretending not to notice each other's luggage, encroaching on shared armrests. "You were the best nurse I ever worked with," Donna said. "And I've worked with a lot of nurses." "You're the best charge nurse I ever worked with, and I've only worked with a few, but the ranking stands." "Smartass. Learn from the best." They boarded the plane. Marin took the window seat. Donna took the aisle because Donna had a bladder the size of a walnut and refused to climb over anyone on a 3-hour flight. The middle seat was empty, which felt like the universe offering a small, specific kindness after several weeks of offering very large, non-specific chaos. The plane took off. The ground fell away, the monument shrinking, the Potomac turning into a silver thread, the geometry of the Capitol dissolving into the broader geometry of land and highway, and the scattered lights of a country that was, at this moment, slightly more accountable than it had been a month ago, because a nurse in Montana had documented a blood pressure drop twice and refused to pretend she hadn't. Marin leaned her head against the window and closed her eyes. She thought about what Holcroft had asked, the human element, the thing that made it possible. She had answered with hierarchy, and the answer was true, but it wasn't complete. The complete answer was harder and less suitable for a congressional microphone. The complete answer was that systems don't corrupt themselves. People do. One decision at a time, one silence at a time, one altered record at a time, until the accumulation of small compromises becomes an architecture of institutional failure that no single person built, but that every person inside it chose not to dismantle. And the corollary, the part she hadn't said because it was the part that applied to her, was that dismantling didn't require heroism. It required the willingness to be inconvenient, to document when documenting was risky, to escalate when escalating was punished, to stand in a hallway with security guards on either side of you, and know that the badge they were taking was less important than the truth they were trying to bury. She hadn't saved Sandra Oaks because she was a decorated combat medic with a classified service record and a colonel who would fly across the country to find her. She had saved Sandra Oaks because she was a nurse who checked the blood pressure and wrote it down and told someone, and then told someone again when the first someone didn't listen. That was it. That was the whole story. Everything that followed, the helicopters, the investigation, the Senate testimony, was consequence, not cause. The cause was a woman doing her job correctly in a system that punished her for it and refusing to stop. The plane hummed. Donna fell asleep in the aisle seat with her mouth slightly open, which Marin would never mention because there were some cruelties even combat medics wouldn't inflict. The empty middle seat sat between them like a buffer zone between two lives that had intersected in an emergency department in Montana and would remain connected by the things they had witnessed and the things they had chosen to do about them. 3 months later, Theodore Rennick pleaded guilty to 11 of the 17 federal charges. He was sentenced to 6 years in federal prison and permanently barred from practicing medicine in any capacity. His medical license, already suspended, was formally revoked by the Montana State Medical Board in a public proceeding attended by 9 of the 12 former employees whose careers he had disrupted. Joan Kemper pleaded guilty to 2 counts of administrative obstruction and received 18 months of probation and a permanent ban from healthcare administration. Garrett Pryor, who had cooperated fully, received no criminal charges but resigned from his position and left the healthcare industry entirely. The Elkhorn Valley Medical Center Board of Trustees established the Callaway Patient Safety Scholarship, funded by a reallocation of the hospital's administrative excellence budget, which, given the circumstances, felt like a better use of the money. The scholarship provided annual funding for nursing students from rural communities, with preference given to candidates who had served in the military. Marin didn't attend the naming ceremony. She was in a different hospital in a different state, conducting an oversight review of documentation practices at a VA-affiliated facility that had triggered the same kind of statistical anomalies that had first drawn investigators to Elkhorn Valley. She was wearing a federal ID badge that felt strange against her chest, heavier than a hospital badge, lighter than a military ID, occupying a middle ground she was still learning to navigate. She called Donna that evening from a motel room that looked remarkably similar to the one in Briarfield, because all motel rooms in all small towns in all western states were apparently furnished by the same person with the same beige bedspread and the same questionable carpet. "They named it after me," she said. "I know. I was there. I made a speech." "You made a speech?" A short one. I mostly cried. Marcus recorded it. I told him if he posts it anywhere, I'll reassign him to triage for the rest of his natural life." "What did you say?" "I said that the best nurse I ever worked with was the one nobody looked at twice, and that the next time someone in a position of power tells you a person doesn't matter, you should pay very close attention to that person, because the ones who don't matter to people in power are usually the ones who matter most to everyone else." Marin sat on the beige bedspread in the motel room and held the phone and felt something she couldn't name. Not pride, not gratitude, not the clean satisfaction of a resolved conflict, but something messier and more human than any of those. Something that felt like being seen by the right people in the right way for the right reasons, after a very long time of choosing not to be seen at all. "Donna," she said. "Yeah? I'm glad you brought the card. To Linda Hartwell's going-away lunch. Even if you didn't say anything. I'm glad you were there." Donna was quiet for a moment. "You know that doesn't let me off the hook." "I know, but it means you were in the room. And being in the room is the first step towards saying the thing you should have said. You just needed more time. 2 years is a lot of time. Some things take what they take." They talked for another 10 minutes about nothing important. Marcus's latest scheduling disaster, the new chief of surgery's ongoing bewilderment at nursing documentation, the weather in Montana versus the weather in wherever Marin was this week. The conversation was ordinary in the way that the best conversations between people who have survived something together are ordinary, small, warm, grounded in the shared understanding that the extraordinary things have already been said, and what remains is the daily work of being human in a world that doesn't always reward it. Marin hung up. She set the phone on the nightstand beside the federal ID badge and Pearson's business card, which she still carried, not because she needed the number anymore, but because the card represented a choice, and choices were the only things a person could carry that didn't get heavier over time. She turned off the lamp. The motel room went dark. Outside, the unfamiliar sounds of an unfamiliar town settled into the background. Distant traffic, a dog barking somewhere, the wind moving through trees she couldn't see. She didn't check the corners of the room. She closed her eyes, and for the first time in longer than she wanted to count, she slept the way a person sleeps when they've stopped running. Not peacefully, not perfectly, but deeply, all the way down, with nothing left undone and no one left to prove wrong. And the quiet, stubborn knowledge that the most powerful thing a person can do in a broken system is refuse to break with it.